So I'd just like to say good morning to everybody who's attending this webinar on acupuncture in Ireland. It's been hosted by the NUI Galway Confucius Institute of Chinese and Regenerative Medicine, of which I'm the Irish director. And we're joined by speakers from Ireland and China, and panelists who have a long experience in practice of acupuncture in Ireland. And so I'll be interested in the panel discussion to hear some of their views. I'm going to begin with an introduction to why NUI Galway is involved in this area. And I'll just share my screen to start the slide presentation. So this is the title slide depicts that we've established in Galway a specialized Confucius Institute focused on Chinese and regenerative medicine. So there are about 500 Confucius Institutes globally, and of them 16 have a specific focus on Chinese medicine. The rest are more traditional and focus on language and culture. But there are 16 of them that I'll refer to a little bit more in my introduction that have a special emphasis on Chinese medicine. We have uniquely a special emphasis on the interface between Chinese and regenerative medicine, the latter of which is our area of research interest. So as you all know, traditional Chinese medicine is a major product of Chinese culture, but it's not practiced very commonly in Western health systems. And largely, I suspect that's because it's experience-based rather than evidence-based. And TCM uses herbs, but not single molecules. And TCM has theories, but it's yet to define molecular mechanisms. So Xi Jinping, in opening another Confucius Institute of Chinese Medicine in Australia, which is also partnered with Nanjing, who are our partners, has emphasized the importance of developing an evidence base for Chinese medicine and expanding its utility and use across the globe. So it's benefited, and as I said, many of you attending this webinar and who are on the panel and speaking have much more experience of this actually than I do. But Chinese herbal medicine, acupuncture, tuina has been, beneficial to people in China for thousands of years. And in recent decades, I suppose it started to be practiced with limited adoption in the Western world. I just mentioned as an anecdote at the bottom there, my first exposure to acupuncture was when I was a medical student in the North Infirmary with Dermot, who's a speaker later. But there was a case of an elderly, very infirm man who had a hernia repair under acupuncture. And that was my first kind of exposure to it. And as a clinician, really, I've had no exposure to it since. But I'm aware that things like the NICE guidelines are highlighting that there are some evidence-based uses of acupuncture, for instance. So we've been influenced by Yu Tu, who got the Nobel Prize for Physiology or Medicine in 2015. And Yu Tu discovered artemisinin from a Chinese herb, which is now used in standard malaria treatment, has probably saved the lives of millions of people. As a group here in Galway interested in regenerative medicine, we felt that it might be an opportunity to explore Chinese medicine products and Chinese medicine herbs and their molecules and their regenerative potential. And we have a stem cell regenerative medicine program here in Galway, so we partnered with Nanjing in setting up this initiative. So just to give a brief introduction to regenerative medicine in Galway. So this is the Regenerative Medicine Institute, which I established with a colleague, Frank Barry, in 2004. So we've been working for the last 16 years in this area. And we've also built a GMP facility that manufactures cells for administration in human trials. And we've also built a clinical research facility with a special emphasis on doing clinical trials in stem cells. So we're currently involved in 7 clinical trials of stem cells in a variety of different disease states. Now, Professor Sanbing Shen, who's on the panel and a colleague of mine here in Galway, his interest is in using this new technology of induced pluripotent stem cells, where you can take a skin fibroblast, convert it back to a pluripotent cell, and then bring it forward to any cell type you want. So that was a Nobel Prize also actually for the discovery of that technology, Yamanaka, a number of years ago. But Sanbing has a whole range of stem cells from diseased patients with, diseases of unmet medical need, recalcitrant epilepsy, motor neuron disease, sudden cardiac death, families and kindreds. So we have the ability to grow a heart or brain or kidney or liver from these patients. And Sanbing has a biobank. And then in Nanjing, they have a whole range of Chinese herbs and molecular libraries that we can explore their regenerative potential in our stem cell models. So I visited Nanjing University of Chinese Medicine in May in 2018, January 2019, and with Sanbing and other colleagues, we had a lot of discussions with Nanjing University of Chinese Medicine to apply to Hanban as it existed at the time to establish a Confucius Institute with a special emphasis on Chinese medicine. But unlike the other 15 existing Chinese medicine Confucius Institutes around the world, it was with the research emphasis on discovering new products and their regenerative capacity. So we signed the Confucius Institute of Chinese and Regenerative Medicine in February 2019. So the Vice Minister for Education from China attended, signed the agreement with our president, Ciarán Ó Hórpairdeig, and attended by the ambassadors and mayor in Galway. And then in the bottom right, the team from China, Guangming on the left there, who's the Chinese director, arrived in Galway. And we're pictured there outside the Asian Tea House in Galway when they just arrived. So the Confucius Institute of Chinese and Regenerative Medicine at NUI Galway will have a role in education. And that includes both language and culture, but also the introduction of Chinese medicine into our medical curriculum and into postgraduate arenas. We'll have a role in exploring the clinical practice and then research. As I said, we want to identify effective compounds from Chinese herbs with the potential to regenerate brain, heart, kidney, etc. And we've also established a global alliance of the Confucius Institutes of Chinese Medicine, of which, as I said, there are 16 of them around the world, and we have an alliance of those now. So this is a slide just introducing the global alliance of Confucius Institutes of Chinese Medicine. Sanbing here in the bottom picture is introducing the concept at the annual Confucius Institute meeting. So all 500 meet once a year. And on this one, we proposed the creation of a subgroup of them, which are located in the 5 continents and have an emphasis on Chinese medicine. So we had our first meeting of the Global Alliance of Confucius Institutes of Chinese Medicine in September 2020, and it was obviously online because of COVID, and it's the director here of the International Education Foundation, which is now the body that oversees the Confucius Institutes. So it's been moved from Hanban, a government agency, to this International Education Foundation. But on this online forum, we had representatives of the 16 globally placed Confucius Institutes of Chinese Medicine, and we've established an executive committee and a program of work that includes global education. So we have a seminar series that's recorded and captured on a YouTube channel we have to bring some collaboration across the 5 continents. So some of our anticipated benefits of building this global alliance of Confucius Institutes and Chinese medicine are shown here. So improving Confucius Institute recognition. So as we ourselves in Galway, while focusing on Chinese medicine, we're specifically and particularly interested in the interface between Chinese medicine and regenerative medicine. And can we emulate UU2 and find a product or products or molecules of benefit? With this global alliance will be a platform to connect other Confucius Institutes interested in traditional Chinese medicine. We'll share resources, policy, experience for teaching, clinics, and research. So in our sessions, we have, South Africa, Brazil, Arizona, telling us how Chinese medicine is practiced in those environments, what the regulatory environment is, what the educational requirements are. And future plans for the development. We've established now actually the executive committee, and we're meeting quarterly. We have a bi-monthly online seminar, which any of you are welcome to attend. There'll be 2 speakers from the various Confucius Institutes around the world of Chinese medicine. And then we'll also have an annual meeting around Chinese medicine, driven by the Confucius Institutes of Chinese medicine. So these are some of the people I'd like to thank in terms of establishing this global alliance. Mr. Zhu Tian is the Vice Minister of Education for China, specifically with responsibility for external partnerships. And so that's an introduction to how Chinese medicine has ended up in NUI Galway, so to speak. It actually followed a meeting of the city of Nanjing officials to Ireland, Cork, Dublin, and Galway. And when they visited Galway, they invited us to visit Nanjing. And during that, knowing their strength, Nanjing University of Chinese Medicine is one of the top Chinese medicine institutes in the country and one of the first established in 1940. We and our interest in regenerative medicine, and knowing UU2, and that's suggesting for any moment that we'll be getting a Nobel Prize, but we would certainly like to. We have now mechanisms in science and technology which hopefully can compress the time that UU2 had to do with the methodology available then, using high throughput screening methodology and such to find molecules from their compound libraries that might promote nerve stem cell regeneration or survival, for instance. So that's the background. We'll have a broad range of responsibilities, which will include research, but also the education and clinical practice of Chinese medicine in Ireland. And we're learning a lot, as I said, from our Brazilian, South African, Thai, Japanese, Portuguese. These are some of the places that the Global Confucius Institute of Chinese Medicine are located. And we're going to draft a report of the global situation in terms of regulation, practice, education requirements. But today I'm particularly interested in hearing from you, all of you who are involved in the practice for a lot longer than I am. So I'm here to learn and see what the potential needs are and how a university like NUI Galway can contribute to that future. So that's my introduction, and I'd be happy to take questions later. We'll have lots of time in the second half, but because of the time, I'm going to move straight on to introduce our Chinese partner, Nanjing University of Chinese Medicine, and they're represented today by Jiabei Hui. So I'm very thankful for Jiabei to attend today. She's a graduate of the Nanjing University of Chinese Medicine with a master's degree. And she's been engaged in international student and education administrations and affairs at the Nanjing International Acupuncture Training Center and oversees traditional Chinese medicine training management for more than 10 years. So she's heavily involved in probably some of the activities that maybe Dr. Ward will tell us about later in terms of international education undertaken by Nanjing University of Chinese Medicine. She's currently in charge of international students enrollment in Nanjing University of Chinese Medicine, and is engaged in a TCM market survey, special course designed to group students, and short-term programs. So she's also a competent multilingual user in English and French, as well as Mandarin. So thank you very much. And I'll hand you over now to Ms. Hui. Thank you.
Okay.
Oh. Dear respected professors, doctors, and dear respected team, we would like to thank you for the invitation and the opportunity to be part of the webinar. I will present a brief introduction to Nanjing International Acupuncture Training Center. My PPT will be divided into 6 parts. Part 1, why choose Nanjing University of Chinese Medicine? Part 2, about Nanjing International Acupuncture Training Center. Part 3, study short-term programs with Nanjing International Acupuncture Training Center. Part 4, about the students. Part 5, available programs to support students' continued professional development, CPD. Part 6, common topics at the webinar. Now let's start with part 1, why choose Nanjing University of Chinese Medicine? First, I'd like to describe highlights of the university. It is one of the earliest universities of traditional Chinese medicine and earning the distinction as the birthplace of TCM of higher education. It is a university included in the double first-class university plan. Double first means the university participated in China's construction plan of world-class university and first-class discipline. It is one of the key universities in Jiangsu province. It is a university co-sponsored by the People's Government of Jiangsu province and the National Administration of TCM of the People's Republic of China. It is WHO Collaborating Center for Traditional Medicine, and also it is the International Acupuncture Training Center designated by WHO and the Ministry of Health of China. At the top of this page, there are 7 photos. The history of the university can be seen in the changes of its main gate, and below are some of the current scenery from the university. The following is a ranking of the university. It is included into the US News World University Ranking 2018 disciplines of Chinese Materia Medica, Integrated Chinese and Western Medicine have all won Class A disciplines in the Ministry of Education's 4th evaluation. It is classed as #1 among Chinese colleges and the universities of Chinese medicine consecutively in 2016, 2017, 2018, 2019, and 2020 evaluation. Included into the US News World University Ranking 2017 and included in SIMAGO Academic Top 128 ranking for Chinese universities 2018. It also placed 17th in double first class and the disciplinary construction universities ranking 2019 for education quality. Part 2, about Nanjing International Acupuncture Training Center. First is for the brief introduction. Nanjing International Acupuncture Training Center approved by the Ministry of Health in 1975, is located on the campus of Nanjing University of Chinese Medicine. The university is a renowned higher education institution for TCM in China and is WHO Collaborating Center on Traditional Medicine designated by the World Health Organization. The training center is one of the first authorized international acupuncture training centers in China and has undertaken the tenet to promote the knowledge of TCM and acupuncture to the world since 1976. The training center enjoys a high reputation in the world and currently has established extensive communications and contact with over 90 countries and regions. The TCM programs provided by the center cover TCM clinical medicine in various medical departments, including acupuncture and moxibustion, TCM herbal medicine, trainer massage, TCM rehabilitation, and health preservation. The following is the training history. The center keeps in pace with international education of China. It began to enroll international students from 1957 and opened the international training programs from 1976. It is the first TCM institution authorized by Ministry of Education to receive international students and also students from China, Taiwan, China, Hong Kong, and China, Macau. About these two old photos, the first showed the students from Soviet Union and Mongolia practicing acupuncture, and the second demonstrating acupuncture for students from North Korea. The third photo showed a herbal course with Dr. Huang, who is well known in the application of classic TCM herbal medicine. Part 3. Study short-term programs with Nanjing International Acupuncture Training Center. First, we guarantee excellence in training, safe practice, and professional contact. The training center offers Chinese medicine, acupuncture theory, and clinical practice, providing a solid foundation of TCM basics, together with TCM ethics, providing a full understanding of TCM and acupuncture approach to healthcare. 2. The short-term acupuncture courses substantially meet the requirements of international students. The short-term program is developed and prepared through discussion and evaluation from course staff and coordinators, students and graduates of the program, and feedback through external examiner reports, teaching observation, and student assessment in the classroom and a hospital. The following, I would like to describe the e-learning organized during the COVID restriction. In spite of the current pandemic of coronavirus, we are glad to be able to offer and continue teaching acupuncture and other short-term programs to students. Our already extensive online resources, together with online seminar, ensures the student can study safely at home. A few examples regarding e-learning teaching in acupuncture and herbal medicine. Teaching case 1 to Western medicine students from Hubbard University, Switzerland. On December 23, an online research seminar was held to officials of Hubbard University, Switzerland. Professor Zhang Xu, my boss, she presided the seminar, and Dr. Shi, who is the Dean of the Respiratory Department of the first affiliated hospital attached to the university, shared his experience as TCM expert in treating Wuhan patients when the city was in lockdown during COVID-19. David Shi analyzed the patient's situation, and described the usage of TCM formula to alleviate the severe symptom based on patient's syndrome differentiation. On April 5, an online program was organized by NJUCM to students of Freeport University with teaching content as follows. General introduction to acupuncture and meridian. Introduction to Tuina, Chinese herbal medicine, brief history of Chinese medicine, a brief history of Chinese medicine, and a virtual demonstration of Chinese herbal medicine course. The case 2, e-learning to 180 students from Chilean and Argentina TCM colleges. On January 11, between January 11 and January 22, a large-scale online program was successfully undertaken by our university. The program was fully financially supported by National Language Education and Cooperation Center in Beijing, and nearly 180 international students, including Western medicine-based doctors, nurses, and pharmacists from South America attended the course. Our Vice President, Professor Sun, and Director, Professor Zhang Xu, attended the opening and closing ceremony. The acupuncture course in this program was tailored upon students' requirement. Course 1, Fundamentals and Clinical Application of Governor Vessel. The lecture is given by Professor Zhang Jianbing. The course content. The course introduced the origin of the governor vessel, its relationship to the spine, the meridian pathway, and the spinal disorders such as brain diseases and spinal-related diseases that could be diagnosed and treated by governor vessel. Course 2, Treating Depression by the governor vessel. The lecture is given by Professor Zhang Jianbing as well. Clinical data. Professor Zhang collected patients' cases at Nanjing Brain Hospital. Diagnostic criteria according to the Chinese Mental Disease Classification Scheme and diagnostic criteria. Examination scope. Spinal segments of the governor vessel. Results. The rate of tender points, the number of tender points, the distribution of tender points. At last, Professor Zhang discussed about the selection of the acupoints. Course 3, Location and Deep Puncturing Technique of Barrio points in pelvis. The lecture is given by Professor Wang Lingling. Course content. Barrio acupoint is important to treat pelvic floor disease. The lecture explained the location method, needle selection, puncturing angle, electroacupuncture, as well as arrival of qi. Case 3, e-learning to 130 TCM doctors from Singapore TCM Association. On March 7, the university launched an online TCM seminar to more than 130 TCM doctors in Singapore. The course named Disease Syndrome Theory with Application of Classic Formula. The lecture is given by Professor Huang, worldwide famous for classical formula. Course content. Classical formula principle with its application in internal medicine, gynecology, neurology, etc. Here I would cite one patient complaint about insomnia with diabetes. Patient history. The patient suffered from liver cirrhosis for more than 20 years and diabetes for 6 years. She was hospitalized in April of 2020 due to upper gastrointestinal bleeding. After she was discharged by the hospital, she began to suffer from insomnia with manifestation of thirsty at night, yellowish complexion, abdominal distension, dark red and peeling tongue coat, slippery pulse. Result: Dr. Huang Hua analyzed the case based on syndrome differentiation and guided Singaporean doctors how to make a new formula to improve patient stimulation. Part 4, about the students. First is about the students' background. Most of our short-term students are mature students with many different backgrounds, with or without a professional medical or health background. Many choose to study acupuncture as a second career after experiencing the benefits of healthcare treatment in acupuncture and wanted to embrace a very different way of looking at health and diseases. For these four photos, students both they come from Professor Bernadette's group, and they visited the university and hospitals in each October. The students enjoyed their journey in Nanjing as the hospital experience helped them expand their clinical horizon. For the second photo, Dr. graduates from our university with a PhD degree. And on right side is my colleague, Dr. Gu, and he is in charge of the translation. About a valuable source of our group students, our short-term graduates from Ireland and the UK, Italy, Switzerland, USA, South America, and Australia. They have practiced successfully throughout the world since 1976. Group students usually make up 80% of the total. Group students mainly from the following organizations. And at the right side, there are 3 photos. The first is a get-together photo for Professor Bernadette, my director, Professor Zhang, the previous principal of the university, and the previous doctor from the Exchange and Cooperation Office. The second one showed the Italian group. Students are both Western medicine doctors. The third one showed the American students. They are master or PhD students from their own local region and seek for practice at the university. Part 5. Available programs to support the students' continued professional development, CPD. Available programs. NJUCM keeps in providing the best quality of teaching and places great emphasis on students' requirements of continuing professional development. Various programs are offered and the best learning environment are provided within 2 campuses, Hanzhong campus in the city center and the Xianing campus in University Town. We guarantee an evidence-based safe approach to practice, foster the professional contact and critical reasoning to help students refresh their professional qualification. Meanwhile, we encourage students to submit study questionnaire to school in order to enhance our teaching quality and patient care. Our program is based on non-TCM background students and TCM background students. For non-TCM background students, we would recommend 3 months introductory course Course content, the basic TCM theory, basic acupuncture theory, basic manipulation techniques, and 120 common acupoints, diagnosis and treatment of 25 common diseases according to TCM channel and syndrome differentiation as listed by the World Health Organization. For example, stroke, headache, stomachache, dysmenorrhea, common cold. For students with TCM background, we would recommend the 3 months advanced course, clinical study, lectures, tutorials, and seminars, and special short-term courses. For 3 months advanced acupuncture course, the course content is extensive learning and application of basic acupuncture theory, systematic introduction to the channels and collateral theory, extensive knowledge and application of 250 acupoints. All programs could be tailored to meet students' requirements. The Clinical Skills Refresher Program is available to TCM practitioners that want to refresh and update their clinical skills. Supervised classes. Students could participate in treatment under doctor's directions. Usually, doctors will allow students to perform needling in the limbs where patients were comfortable to allow students to needle. The summary of program outline, we have regular 3 months programs, non-regular short-term program. For regular 3 months programs, we have 3 months introductory acupuncture course and 3 months advanced acupuncture course. For non-regular short-term programs, we have flexible short-term courses, clinical study, seminars, lectures, and clinical practice, and special short-term courses. For special short-term courses, we have 19 types. For example, classics in theory and clinical application of inner canon. The theory and clinical application of main hairstyle for spleen and stomach diseases. Application of integrated Chinese and Western medicine treatment for cancer. New theories and techniques in TCM conservative therapy of herbal medicine, infant trainer study, trainer school, trainer manipulation techniques, trainer treatment for common diseases in TCM internal and gynecology department, health TCM Qigong exercise, Shaolin internal Qigong study, TCM Qigong study, 5 animal exercise, and health maintenance course, TCM health strengthening and rehabilitation exercises, classical acupuncture technique study, specialized therapy in acupuncture and moxibustion, cosmetic acupuncture, TCM health preservation, and Chinese medicated diet. The following, I would like to have the hospital description. 16 teaching hospitals are available, including acupuncture department in Western medicine hospitals. The internship content covers general clinical practice and lectures as required on subjects such as gynecology, neurology, cardiology, urogenital system with treatment of herbal medicine and acupuncture. This will help students advance their understanding of theory and practice in TCM. About the lecture description, for demonstration purpose, we will show lecture arrangement for some groups as a reference. The first Italian group, see the photo 1, the upper side, and the Irish group, the middle photo, and the Chilean group, the last one. Here's the table 1. showed the table 1, it is the Italian group asked for lecture in treatment of gynecology, skin disease, internal medicine, and TCM health diet course. For table 2, Irish group focuses on various needling techniques with various diseases. For table 3, Chilean group focuses on treatment based on classical TCM literature. Part 5, common topics at the seminar. NJU would publish the following data concerning Irish students as collected by Professor Bernadette. Professor Bernadette categorized her last 101 students in terms of age, gender, educational background, and nationalities. We thank you for her contributions. Here are the graphs, graph 1, graph 2, graph 3, graph 4. We drew the conclusion from the age structure, the largest age group is the 30 to 44-year-old group, which is 58% of the total data. The group between 45 to 60 is the second with 24%, while the youngest group between 18 to 29 is the last. From the gender structure, it shows that women have an absolute advantage in this profession. 3, from the angle of prior education, it shows that 75% of students had a prior degree, while 25 didn't. 4, from the angle of nationality, it shows that the top 3 nationalities are Irish with 63%, British with 14%, and Chinese with 4%. Question 1, how do they become an acupuncturist? I personally think that there is an agreed and fixed professional pathway to become an acupuncturist within the Registration Association in Ireland, the UK, the EU. Students could check the web of ATCM, WFAS, WFCMS for reference. And for how do they become an acupuncturist, I would say that a 3-year professional training course is the basic standard for professional registration and practice in Europe, the USA, and Australia, and many countries. Professor Bernadette's school, AFI, have been training acupuncturists since the late 80s, registering them for professional practice across the world. Question 3, where do they practice? As we know, in private clinics, and the student should pay for treatment, maybe insurance company could rebate for part of the treatment. Question 4, how do they maintain their skill? Each registered acupuncturist must earn the necessary CPD credits to maintain their membership. This will involve the lecture, seminar, extra. AFI organized the clinical work placement in Nanjing, China each year. This is as part of a joint agreement between 2 schools. For Professor Bernadette, as an acknowledgement of her work and the profound love to TCM, she was appointed as a visiting associate professor to NJUCM. That's all for my speech, and thank you for your listening.
Thank you very much, Jabe. That was very informative. So if there are any questions, we might have some time to take some now. And thanks for highlighting the work of Bernadette in all of her years supporting this this activity. we'll hear more from Dr. Ward later. So if anybody wants to put a question, can I ask Jabe, how much does it cost to do a 3-month? How do people fund going there for 3 years? Sorry, 3 months. 3 months, going there for 3 months to either the basic course or the advanced course.
So Professor Tim, do you mean the price?
Yes.
Do you mean the price of a 3 months course?
Yes.
It's not expensive, you know, it's in Chinese yuan. And can I email to you later because the price is different?
Yeah, that's fine. And we can, maybe other people, if they're interested in learning more, they can, there might be specific price differences between courses. Yes, thank you. That's good. Yes. So you mentioned a basic, you know, to become an acupuncturist, having a 3-year course, a 3-year course. What's the standard requirement, you know, for somebody to become an acupuncturist in China?
In China, basically speaking, students should have a 5-year training for bachelor's program. Then they have chance to become an acupuncturist if they could pass the examination. But in Ireland, I heard that basically it is for 3-year training.
Okay, but in China it's 5 years. And at the end of the 5 years bachelor's, is the student graduated in herbal medicine as well, or is it just acupuncture?
Here we say TCM, doctors.
Yeah.
So students could choose either TCM undergraduate program or acupuncture program. Because here for acupuncturist, students is specialized in treating patients with needle. While for TCM doctor, students here in China, they are specialized in formula, I mean herbal medicine. And for students from Ireland, strongly I recommend our 5-year bachelor program if they would become an acupuncturist in China. Okay.
And are there 2 separate courses, 2 separate 5-year courses for acupuncture and herbal medicine, or is there a single combined course where you could do 5 years and practice both?
I understand here at our university, we have 2 sections, TCM section and acupuncture session. But for international students, and most of them, they would like to study TCM undergraduate program, because for this program, they already involved acupuncture program. And then students could pursue their master's courses specialized in acupuncture.
Can I ask in Chinese?
好的。
好，那个就是这个学位，是2个完全分开来的学位是吗？还是有一个学位，既可以是开药，又同时可以针灸的学位？
在中国的话，如果你是中医或者针灸的话，在诊所都是可以开药和针灸的。但是我们的老百姓他喜欢，如果开药的话，就会找中医内科、中医妇科、中医儿科之类。然后如果是针灸的话，因为我们是有针灸 department 的，所以他们喜欢专门的找就是针灸医生。但其实针灸医生也是可以开药的。
Okay, thank you. So
Thank you.
There's a question on the chat from Professor Gerald Flaherty, and he's asking: is the practice of integrative medicine, combining the best elements of both traditional and Western medicine, is it popular in your region of China?
Yes, we do have, but for international students, we strongly recommend TCM undergraduate program or acupuncture undergraduate program, because here I don't know if our Western medicine, I mean the course could be recognized in Ireland.
Yeah. And what about for Chinese people, for people from Nanjing? Are there many people do the integrative or Western or Chinese alone? What's
At our university, TCM program, acupuncture program, or integrated TCM and Western medicine, they are the three top programs. I mean, very popular at our university.
Okay. There's another question here in the question answer. Will there be online seminars about acupuncture for depression or anxiety or mental disorders in general in the near future? Will there be any online seminars available to people in Ireland about acupuncture for depression, anxiety, or mental disorders? We're likely to have a lot of mental disorders. We are during the lockdown and after it. The question is, will you have any online seminars available on acupuncture for depression?
I understand what you mean. We do have online seminars, but some seminars are not online. And if you need, we could discuss further.
Yeah, we could also think about it in the context of our Global Alliance seminars, to have a one on anxiety, depression, and mental disorders, acupuncture for that. Okay, there's another question. Is there a course available in pediatric acupuncture or pediatric or infant tuina? That's a question. Pediatric acupuncture?
Oh, I understand. For acupuncture, we do have pediatric acupuncture, and Irish students already had this kind of experience. The needling technique is different than the adults needling. And also for pediatric here in China, it means for herbal medicine. But the pediatric, I understand that Irish students, they would have infantile tuina, infantile acupuncture, infantile herbal medicine. But here is a combined one. I think that Irish people, if they would like to study TCM or acupuncture, they could email to our university, and then I could reply in detailed information.
Okay, thank you. Sanbing, did you want to say something?
Yes, there was a CACC and the award to pediatric acupuncturist in Qingdao Children's Hospital, and who would like to come to Galway and with contact the last year. And that's something probably we can, if she is approved to come to Galway, and we may explore that further.
Yes, Dr. Ward also has some comments in the chat. Panelists. In the EU, 3 years is the basic standard for TCM professional practice. So that's an agreed standard. And adding herbalism adds 2 years to professional training. So maybe we'll follow up on that, Bernadette, in the panel discussion later. Okay, so I think in the interest of time, we'll move on to the next speaker. But thank you very much, Jabe. And we if we have further follow-up questions, we'll plan to be in touch with you. But thank you very much for your speech and your participation.
Thank you. Thank you.
Okay, so I'm going to move on to the next speakers. And it'll be Dermot O'Connell and John Burke. And it's my great pleasure to introduce Dermot. Dermot is a classmate of mine from UCC. And actually on the first day in medical school, we ended up sitting next to each other because he's O'Connell and I'm O'Brien, and we were in the same group throughout medical school. And Dermot is a GP in Cork and long interest in acupuncture, trained in China and lived in Canada and practiced, and is back in Cork now. And John is a GP in Newmarket in County Cork, and they represent the medical acupuncturists, and I'll be very interested to hear in the next two presentations how acupuncture fits into a general practice. John will certainly be telling us about that, and Dermot will tell us about some of the uses and maybe the evidence or not around the use of acupuncture. So thanks to the two of you on a Saturday morning when I know you have lots of things going on in practice, and not least of which is vaccinations and such. So I'll hand over to Dermot then. Thank you. We're going to share your slides.
So I'd like to thank Professor O'Brien, Tim, and the Confucius Institute for asking us to speak and for organizing the meeting. Yeah, Ms. Hui's presentation brought back many memories of Beijing 30 years ago, and the pictures of the graduating students and the hospitals reminded me of that, which was nice, of all those good memories. So yeah, I'm a GP in Cork. I've been using acupuncture for about 30 years. I do all the usual GP stuff. About 30 to 40% of my practice is acupuncture. I treat probably mainly musculoskeletal problems, but also lots of other stuff as well. I trained initially in Canada in so-called medical acupuncture, and I was lucky enough to spend 6 months in Beijing back in the early 90s. I did the introductory course in acupuncture, and I found that very useful. Next slide there, Dave, please. I'm not that unusual in using acupuncture. I think in Ireland there are about 10 of us, including myself, John, and some others who would GPs who would use a lot of acupuncture, and there are probably about another 40 or 50 doctors who would, however, have some training in acupuncture and would use acupuncture to treat, again, large musculoskeletal problems. In the UK, this medical acupuncture world is more developed. The British Medical Acupuncture Society have, last I looked, about 1,000 GP members and a few hundred hospital doctor members who would use acupuncture as part of their practice. These are sort of old figures now, but about 5% of UK GPs will practice acupuncture. And those figures have increased a lot in the last number of years because of the NICE guidelines, which are very important for UK practice. And recent NICE guidelines have advocated the use of acupuncture in some conditions. Again, looking over there, yeah, about over 50% of GPs would, UK GPs, when surveys, would recommend or would refer patients for acupuncture. And the bottom line there on the left, about most NHS large pain clinics, so-called pain services, will offer acupuncture as part of their treatment. In Ireland, it's probably a little bit less developed than that. The British Medical Acupuncture Society, which trains medical doctors in the UK, is largely based on the medical model, and this sort of the clinical evidence in support of acupuncture. Next slide, Dave, please. But of course, everybody who uses acupuncture realizes that acupuncture has been used for millennia in China on millions of patients. And so the huge experience and tradition and learning that has been accumulated in China forms a background, I think, for everybody who's using acupuncture. It's interesting, like, even though acupuncture was used in China so much, there has been acupuncture used a little bit in Western medicine through the centuries. William Osler's textbook of medicine, which would have been used in Ireland in the 1800s, 1850s approximately, his advice for treating lumbago, low back pain, was the insertion of fine needles into the paraspinal muscles. That was about 1850. And I think over the 19th to 20th century, a lot of French and German physicians would have used acupuncture. And next slide, Dave. But it wasn't until President Nixon went to China in the 70s that acupuncture began to be looked at a little bit more seriously by Western medicine. And next slide again. So pictures like this, apologies for the poor quality of this picture now. This is one I took at a cesarean section in Beijing. But pictures like this were shown on TV, and I remember them in the 70s. And it looked like that acupuncture was being used as the main analgesic in surgical analgesia during pelvic and abdominal surgery. And on the picture here, if you try to make out the on the top left, there by the bright light, the nurse is carrying away the baby. And down at the bottom right, you have the surgeons, or the right, you've got the surgeons closing up Doom's tummy. And in the middle there, I'm not sure, can you see it, just under the drip stand, the mammy there, the mother is smiling away, happy out after her C-section. So this was remarkable to people like me because providing this level of analgesia for major surgery without the side effects of anesthetics, etc., was remarkable. Next slide, Dave. So many people thought this must be some sort of a trick, but it isn't. And a lot of research went into this back in the early days. Some of the earliest research came out of the dental school in Berkeley in California. And they quickly showed with CSF studies and lumbar puncture studies that acupuncture increased the levels of circulating beta endorphin and beta dynorphin in the blood and in the CSF, central spinous fluid. And so these endogenous opioids were released after acupuncture and relieved pain. They closed the so-called pain gates. And naloxone, which is an opiate antagonist, largely reverses the analgesic effect of acupuncture. And these studies were well published in med textbooks, etc. So next point there is that, sorry, Dave, go back again, pardon me. The next point there on that slide is that acupuncture also, we know, it activates inhibitory pain pathways in the spinal cord, and it interferes with pain transmission along spinal pathways, which also confuses or interferes with pain signals. The third point there is ACTH. It's ACTH, which releases steroids into the body. ACTH is released at an equimolar rate to endorphin. And so ACTH increases the level of circulating steroids, which again may be responsible for the anti-inflammatory effects seen with acupuncture. And these other things here moving along, LH-FSH ratios are altered, which may help with fertility. Small intestinal motility is reduced. That's small intestinal, so that small intestinal motility is reduced. So that probably is a reason why acupuncture is effective or can help with irritable bowel syndrome. Last line there, serotonin and dopamine are released. Again, anybody using acupuncture will realize that acupuncture gives people that sense of relaxation and well-being. So whether it's an endogenous opiate effect or an effect of serotonin or dopamine, who knows, but we know what happens. Next slide, Dave. So more recent work then, which again, it gets more and more interesting, that we know acupuncture reduces these pro-inflammatory markers, TNF and interleukins. So acupuncture, even though the research is still incomplete and we don't know the full story, we have more than enough information to say how acupuncture works, affecting pain transmission and interfering with pain nerves, blocking pain, closing pain gates. But also the interesting thing, and maybe it would interact with Professor O'Brien's regenerative medicine, is that, you know, we know it has these anti-inflammatory effects and can stimulate all sorts of healing in tissue. Next slide, Dave. So this is a slide that I show doctors just to demonstrate how acupuncture works, or how we think it works. So apologies to any neurophysiologists in the audience. This is a very simplified version, but I think it explains what we understand by acupuncture analgesia quite well. So indulge me for a moment. If you just look at the exclamation mark in the bottom left of the slide, let's say that's a pain source, some painful area. So let's, for argument's sake, say it's the base of the thumb, the carpometacarpal joint there. So let's say we've a pain in the base of the thumb, very common problem in practice, arthritis at the base of the thumb. So if we have a pain there, what happens is that, again, looking to the slide, we have the pain signals going along slow, large pain nerves, large pain fibers, which then synapse in the spinal cord. That circle is the spinal cord. And the pain then synapses across and goes up that spinothalamic tract, the STT, to the brain, and where pain is perceived up in the brain. So now, what will we do if we were using acupuncture to try to treat that? So if we were using acupuncture to treat that, next slide, Dave, we would insert an acupuncture needle, probably here at large intestine 4, Hagu. Everybody who does acupuncture knows large intestine 4. So we'd use an acupuncture point there. It's adjacent to the pain source. But when we insert an acupuncture needle into large intestine 4, we know that we are selectively activating different nerve fibers called A delta fibers, among other names. But the delta fibers are fast, small nerve fibers, and that nerve signal will travel in parallel with the pain signal, probably here along the radial nerve, and synapse at the same level of the spinal cord. Now we know that the delta fibers, when activated by acupuncture needles, will release release endogenous opioids at that synapse, and therefore closing the pain gates and blocking pain transmission from the parallel pain fibers. And next slide. We know there's also this ascending pathway, so on where the acupuncture signal is coming in there, you'll see a line up to the midbrain. So that's an ascending pathway, which activates in the midbrain, a descending pain inhibitory pathway, which further releases endogenous opioids, next slide there, and closes the so-called pain gate in the spinal cord. So we have very good models for understanding how using acupuncture points relevant to the pain source will reduce pain, block pain transmission along spinal pathways, and probably also have local anti-inflammatory effects, which is the next step. Okay. Now, so we'll carry on. Next slide, Dave. So once we establish that, and when I talk to GPs, I'd say, look, our doctors, next slide again. What's acupuncture useful for? Acupuncture, because of how we just said, acupuncture should be useful for any mild to moderate chronic pain. Throw up the next few slides again there, David, next few. Yeah, you can keep putting on those journals there. Yeah, thanks. Out to ONE. Yeah, the next one. And the next one. That's it, Dave. Yeah. So these are studies now, many of them very old, but they were milestone studies in the medical world, the West, English-speaking medical world anyway, about how acupuncture was effective, and it showed acupuncture to be effective. As doctors, we really need clinical evidence to support what we're doing. And these studies were one of the first ones to show that, to help us with that. So first study, large evaluative research showed acupuncture to be effective for pain. The third one down is sort of interesting. Acupuncture and fibromyalgia. This was a very good Swiss study to show that acupuncture was effective in relieving the symptoms of fibromyalgia. Now, I've been at many medical meetings about fibromyalgia over the years, and I've never heard any hospital specialist or doctor mention this very good study from Switzerland. And I've heard all sorts of other treatments for fibromyalgia, medications, etc., which don't have anything like the same research base or the same clinical evidence as acupuncture. So I always tell doctors, if we're going to be objective, and if we're going to look at the evidence clearly and fairly, if there is evidence for the use of acupuncture, if acupuncture is shown to be effective, then we should use it. The one above there is another study, the post-op, acupuncture post-op analgesia. This was an interesting study at the time because patients were given acupuncture while they were in the recovery room, recovering from surgery. The non-acupuncture group weren't given acupuncture, but nobody knew who got what. So, and then the patients were given a self-administered pethidine at the time. And it was found that the acupuncture group used about 50% of the pethidine post-op as a non-acupuncture group, showing that acupuncture was effective for pain. But equally, it took out the placebo effect because the patient didn't know they were getting acupuncture post-op because they were asleep. So it was a very neat study taking out the placebo thing. Going down there, acupuncture for nausea post-op. I like that study because it was done in Queen's University in Belfast by Professor Dundee, Professor of Anesthetics up there. And he showed that acupuncture was effective for nausea post-op, and also he did another study showing acupuncture to be effective for nausea post-chemotherapy. And I use acupuncture routinely now, excuse me, for treating nausea in pregnancy. But as we know in medicine, you can pull a study out of your back pocket to prove almost anything in medicine these days. Next slide, Dave. So speaking again to medics and about medics and from a medical point of view, using something like acupuncture, which, let's be honest, it's a little bit off center. We need to have as much evidence as possible. So in medicine, I think it would be fair to say that the biggest or the most important and most authoritative bodies on medical research would be Cochrane, our niece. Cochrane reviews are very authoritative. They look at all the research critically, and they add up all the studies together, and they make conclusions as to what treatments will work for what conditions, or where is the solid evidence. So in acupuncture, Cochrane is very positive towards acupuncture. It advocates the use of acupuncture for migraine prophylaxis. It advocates acupuncture for tension headache prophylaxis. It advocates acupuncture for neck pain, and importantly, it advocates the use of acupuncture for low back pain. And in all of those, summarizing it, it'll say that the evidence is in favor of the use of acupuncture for these conditions. The Cochrane also has is middling on some other conditions like acupuncture for shoulder pain, acupuncture for nausea, acupuncture for OA knee. Again, to summarize, it will say that the evidence is positive, but more work needs to be done. Cochrane has also looked at a lot of other issues and has concluded our medical issues, medical problems, and it will say that the acupuncture hasn't been shown to be effective. And apologies for laboring medical evidence, but it's very important for people like me who practice a lot of acupuncture that there is evidence available and we can show the evidence. And if we're going to use acupuncture, if we're going to try to encourage acupuncture to be used more in mainstream, we have to show the clinical evidence. So moving on, Dave, sorry. So the NICE guidelines, National Institute of Clinical Evidence, Clinical Excellence, issued the guidelines in the UK, and they're used really as a foundation for the practice of medicine, particularly in GP and also in hospitals. So NICE, again, look at all the available evidence and look at it critically and come up with recommendations for treating various conditions. So the NICE guidelines published in 2009 for the treatment of low back pain advocated a course of acupuncture or manual therapy or manipulation, but acupuncture was emphasized. And this was very interesting. It was very important in the UK at the time for my UK colleagues. It pushed the use of acupuncture among medical doctors a lot. Those recommendations were largely based on huge studies in Germany done by primary care physicians, the so-called GERAC studies, where they took somewhere between 40 and 70,000 patients, depending on the problem. And they showed that acupuncture was effective, and more importantly, from the German point of view, from German health insurance, German health insurers, that it was cost effective. So that led to a boom in acupuncture among medics in the UK after that. Interestingly enough, though, the more recent NICE guidelines, where they said the treatment of low back pain with sciatica, acupuncture dropped off the guidelines. And they substituted acupuncture with a radio frequency lesioning, which is a fairly invasive, much more invasive treatment anyway. If it was me, I'd much prefer to have acupuncture for my low back pain than radio frequency lesioning. But they did point out one interesting problem with acupuncture research, in that researching or providing clinical evidence on a physical treatment is very difficult, in that what you use is a placebo. The patient knows they're getting acupuncture. You can use sham acupuncture, dummy acupuncture, using acupuncture points nearby, or no acupuncture, but patients sort of know. It's very hard to blind the patient, it's very hard to blind the therapist or the assessor. So that's a problem with acupuncture research. And a lot of acupuncture research will sham acupuncture as the placebo treatment or as the alternative treatment, as the dummy treatment. Is not a good dummy treatment, because if you insert an acupuncture needle anywhere, you're going to get some sort of an acupuncture effect, even if you're not on the correct point, etc. So a lot of acupuncture research is unfairly dismissed a little bit, and they say that the acupuncture is better than sham acupuncture, but not significantly better than sham acupuncture. But if you compare acupuncture with no treatment or with normal treatment, usually acupuncture will come out well ahead if you pick the problem correctly. Next slide, Dave. So the NICE guidelines then on the treatment of tension type headache, which was published in 2018 and updated again more recently, published in 2012 and updated in 2018. And they've kept the recommendation that acupuncture should be used for prophylaxis of tension headache. Is the only treatment in these guidelines that they think there is good enough evidence to recommend for the prophylaxis of tension type headache, which is a huge problem again in general practice and in hospital medicine, I'm sure. So what they say is to consider a course of up to 10 sessions of acupuncture acupuncture over 5 to 8 weeks for the prophylaxis of chronic tension of headaches. That was again largely based on the studies done by German medics, but it fits in very well with traditional Chinese approach. Next slide, Dave. So similar guidelines for migraine, prophylaxis of migraine. Migraine is a huge problem. There's a huge amount of research and pharmaceutical work and products available for the treatment of migraine. But the prevention of migraine, the topiramate and propranolol are one of the more widely used drugs. And what NICE say is that the research is solid, that a course of up to 10 sessions, again, of acupuncture for 5 to 8 weeks is a very good alternative. A lot of people don't want to be on long-term medications for migraine prophylaxis. In the NIC, and I'm sure everybody here who practices acupuncture will treat migraine and headache a lot. And it's such a simple treatment, such a nice treatment, but side effects little or none, and very effective. So yeah, next slide, Dave. So the NICE guidelines, again, apologies for harping on the NICE guidelines, but as I said, we need clinical evidence if we're going to integrate acupuncture into Western medicine. We need the evidence. So the NICE guidelines on the management of chronic pain was great excitement among the medical acupuncture community last week. They were just published on the 7th of April. And chronic pain is a huge problem. About 20 to 30% of people we see in general practice have got some sort of a pain. And modalities for treating them, we have a lot of ways of treating them, but none are that ideal. And NICE concluded, interestingly enough, that pharmacology drugs, the only drugs that they found effective in treatment of chronic pain were antidepressant medications like amitriptyline or duloxetine. Basically, they said there was no real evidence or no good evidence for using most of the drugs we use routinely. Opioids, anti-inflammatories, steroid injections, trigger point injections, local anesthetic patches, paracetamol even. They said there was no good evidence. They did say there was evidence for exercise therapy and psychological therapy like CBT in managing chronic pain. But most importantly for us, they accepted that there was very good evidence for acupuncture in treating chronic pain. And I think this is a big one. People like me, it's a bit of a game changer because if NICE recommend it and accept the evidence is solid, it means it should become part of mainstream practice. Sorry, and Dave, next slide. So the summary of the NICE guidelines there from just less than 2 weeks ago. What we're interested in, again, from today's perspective, in that they say that acupuncture, a single course of acupuncture, either delivered from the traditional Chinese model or in the Western medical system, seem to be both equally as effective. They had interesting recommendations because NICE is a lot about cost effectiveness as well. And they said that the acupuncture should be developed in, or should be delivered in a community setting rather than a hospital, and that it should take up less than 5 hours of healthcare professional time. So you could either interpret that by saying that we should be doing very short courses of acupuncture, like 4 or 5 treatments, not taking up too much healthcare professional time, or it should be longer courses, but at a different level. Next slide, Dave, please. So I'm harping on a lot about the clinical evidence for acupuncture. I have a basic knowledge of Chinese, of TCM, and have it in the back of my head all the time. To be honest, on a day-to-day basis, I think of acupuncture, what I'm doing in terms of medical examination, making the medical diagnosis. I don't use tongue or pulse. And I try to diagnose the medical condition in a medical point of view. Then I try to identify what acupuncture points would be effective for this. So I want to take an example of shoulder pain, because when myself and people like Dr. John Burke, who's going to be talking in a minute, meet, we'd have slightly different sort of trainings, me more medically acupuncture, John more traditional acupuncture. But when we look at what we do, it's not really that different. So I'm just going to take shoulder pain as an example. Again, anybody doing acupuncture will be treating the shoulders a lot. And again, just to bore you guys, when you look at the research on shoulder pain, the benefit of acupuncture is well shown. Like if we have somebody coming in with shoulder pain, I must see 4 or 5 people with shoulder pain every day. So the medical options for treatment are anti-inflammatory tablets that don't work great. Painkillers, fine, but not great either. So steroid injection is probably the most effective treatment for rotator cuff problems or frozen shoulder capsulitis. So injection treatment would be the most effective of the medical treatments. But if you look at the research, and these are 2 very good studies, they show that acupuncture is just as good as steroid injection for the treatment of shoulder pain. And acupuncture, as we know, is much less invasive, less side effects, simpler. So next slide there, Dave. A lot of people will be very familiar with pictures like this. So these are the acupuncture points which would be used and which have been taught, I'm sure, in Nanjing and Beijing for the treatment of shoulder pain. So if I see somebody with shoulder pain, just to make it simple, the 2 most common problems I would see are either a rotator cuff problems like impingement syndrome, where somebody has got a supraspinatus tendinopathy, perhaps they can't raise their shoulder above 90 degrees. And for that problem, that involves the supraspinatus tendon up here and the supraspinatus muscle. So if I'm thinking, okay, so I made a diagnosis of supraspinatus tendinopathy. So I think then, what is the innervation of the supraspinatus muscle? It's the suprascapular nerve. Hey presto, small intestine 12 is just on the suprascapular nerve. I'll stimulate small intestine 12, I'll insert the needle there. Supraspinatus muscle and the musculus tendinous junction, where it slips under the acromion, just here, I can get that with large intestine 16, LI16 there on the model. And then the supraspinatus tendon is inserted in the anterior humerus. So LI15, large intestine 15, is just about there, close enough. So if I'm treating supraspinatus tendinopathy, I'll use small intestine 12, large intestine 16, and large intestine 15. And probably because I have a back, I'm still thinking of TCM, I probably will use Hago as well. And I would expect to get good results with that. Now, moving on, if I had somebody with the typical frozen shoulder adhesive capsulitis, where they had great trouble rotating their shoulder out, then I would, that problem is in the capsule of the shoulder joint. So I would want to use points relevant to the capsule or innervating the capsule. And the best points there would be heart 1, but I don't want to go into the axilla really. So I'll use triple warmer or Sanjo 14 and large intestine 15, and maybe large intestine 16, and maybe again Hagu. And I'm using these points because I'm thinking more of where the lesion is, what's the innervation of that lesion, what nerves or what acupuncture points will stimulate those nerves, because I think I'm much more likely to get a benefit using those. So I think John might talk afterwards, but when I talk to John, when we compare our treatments, we used to have a lot of meetings over the years about treating various problems, and we compare what treatments we would use. And at the end of the day, even thinking on the medical model, or whether you just were using traditional Chinese teaching from 1,000 years ago, we'd end up using pretty much the same treatment and probably getting pretty much the same results. Next slide there, Dave. Yeah, so acupuncture, the great thing about acupuncture is that there really are so few side effects. Acupuncture is a very simple treatment, very few side effects. This is a study published in JAMA a long time ago again. Forgotten needles or feints happen. Apart from that, fine, very little. So again, little anecdote on just migraine treatment. I was at meetings recently where neurologists are advocating this new fashion treatment for migraine, where they inject the occipital nerve up there with local anesthetic and steroid. Now it seems to be effective for migraine. Now they'll freely admit they're not sure whether it's the steroid, the local anesthetic, or just the needling helps with the migraine. But you know, I'm telling them that they don't need to use local anesthetic. They don't need to use a needle or a steroid. Just insert the needle at gallbladder 20, which will hit the occipital nerve and do much the same thing, for a lot less invasively and a lot cheaper, and with no side effects. So just my general point is that, speaking as a doctor, we understand a lot how acupuncture works, not completely. The physiology is not fully understood, but we have a good grounding in it. We understand acupuncture as much as we understand an awful lot of other stuff in medicine. We have good clinical evidence that acupuncture is effective for a range of conditions and is at least as good as, if not better, than the standard medical treatments available. It has amazed me that acupuncture hasn't been embraced more or integrated more into Western medicine. I think, though, if we are if the aim is to integrate acupuncture into Western medicine, you've got to encourage the medical understanding of how acupuncture works, while still acknowledging and respecting the huge tradition and experience and learning of traditional Chinese acupuncture. I think you need to, run those things in parallel, run the traditional Chinese experience, but an understanding of how medicine works. I think talking to doctors, which I've been doing and training GP trainees over the years, you've got to appeal to the scientific side. And I think I'm nearly finished. Dave, can we put on the next slide there? Oh yeah, again, this is just where we're coming from as GPs. About 20-30% of what we see is musculoskeletal issues on a daily basis. Acupuncture is a great treatment for a lot of what we see as musculoskeletal conditions. And these are just some rates. You know, there are a lot of people attending are in pain, and the options we can offer them are reasonable, but acupuncture is a very nice additional option to offer, and I think would give much greater benefits to much greater numbers of people if acupuncture was used more. Next slide, Dave. Yeah, that's the end. That's I tell doctors when I'm talking to them that this is my surgery in Douglas and Cork. That's the temple pepper. So that's me done.
Okay, thanks very much, Dermot. That was fantastic to listen to, really, because as I say, for my area of medicine, we don't think about it that much, but when you mention all those conditions, away the knee, you know, migraine, tension headaches, shoulder pain, they're just so common. So maybe John will follow up now on that, and then we'll open up for a few questions.
Great.
Hi, thanks, John.
Hi, everybody. I'm John Burke. I'm a full-time GP in North Cork. I'm also a continuous medical education tutor to the Irish College of General Practitioners. And I'm here because I fell into acupuncture about 35 years ago now, I think. Looking around to do a course and happened to come across an acupuncture course. And it was actually my wife turned around and said, "Oh, that sounds good, try that." And I got hooked. And like Dermot, once you get stuck into acupuncture in medicine, you feel, why do we not know more about this? Why is this not part of our basic training? I use it all the time. It's a tool in my box as a GP, and a very important tool to treat a huge range of conditions safely, easily, effectively. Not that cheaply, of course, because there's no state support for it. But I suppose it goes back to our training as med students. We're taught by eminent professors, we have a few of them here, who are extraordinarily knowledgeable, but specialized. And the people at the absolute pinnacle of their careers involved in training necessarily can't know much about the wider, commoner, sort of below speciality levels of ill health, which of course is what walks through my doors as a GP every day. And that's really where acupuncture shines in treating people. And the older I get, the more I feel that training of undergraduates in particular, and I'm an undergraduate tutor for UCC. I get students all the time, but that'd be a limited exposure to a few of them. Keep on saying to them that if they're going to get into GP, this is something that we should certainly be looking at, because of what you can achieve with minimal intervention, minimal cost. But again, it goes back to, I suppose there's a chauvinism in all of us. And if it's something you know nothing about, the tendency in all of us is to say, well, if I know nothing about it, that means it's not very good, which of course is not the way to look at it. One of the classic things I would always tell my students is you just have to look at the classic syndromes in Chinese medicine. So you look at deficiency of yin of the lung. I'm not even going to attempt it in Chinese with the current audience, but fei yin shu, or however you pronounce it. And you've got cough productive scantier blood stains, Putin, 5 palm heat, that's warm hands, warm feet, afternoon sweating, fever, red tongue tip, weight loss. And that was described something like 2,500 years ago in one of the classics. A perfect description of tuberculosis. Now, not in a million would I treat tuberculosis with acupuncture, but it shows how adept these people were at observing people, at looking at illness and coming up with the concept, long before we did here in the West, that these were recurring patterns in people and that you could look at ill health from experience and say, yes, these things happen. Now let's see what we can do about it. So I've had a lot of fun over the years with it. I've got people out of wheelchairs, off drugs. More recently, I've been playing with a series of people with MRI-proven cervical disc lesions where they've got proven disc prolapse. Some of them were waitlisted for very interventional treatments, up to and including surgery. And I'm delighted to say that those 8 are all functioning virtually completely symptom-free, and none of them required the interventions that they were listed for. Something I can do in surgery in North Cork, 40 miles from CUH. So it's an intensely rewarding thing to be able to do as a clinician, to turn around and look at a patient, use your skills, use your knowledge, and then go away and fix it. The best part of medicine, of course, is the cure. And certainly not something I'd be without. And certainly something that I think as I get on in years and in practice, I'd be keener to see the promotion of acupuncture as a core skill in medics, because it is so wide-ranging. It is a complete system of medicine, if you like. It's not necessarily the best option for everything, of course it's not. But it needs to be considered as an option, certainly more widely than we do now, I think. And absolutely from a general practice point of view, so much of what we do is potentially dangerous in terms of pain management, in terms of dealing with the chronic, niggly, distressing, debilitating conditions. And when you have a modality that's safe, non-addictive, low side effect, it's essentially time to promote it strongly. And where that will lead, and where this hopefully webinar will lead, is that hopefully we will see a better awareness of acupuncture coming through in terms of people considering it much earlier, rather than as a last-ditch point thing or as a non-integrated part of total patient care. And again, this goes very much back to how I would feel about acupuncture, is that used properly as part of patient management, acupuncturists need to be brought in to the field, just as physios have been over the years, just as CBT practitioners come in, acupuncturists need to be more accepted, more part of that clinical team. And certainly the experience here in Ireland is, it varies. Obviously, it's much easier for me as a medic. Colleagues would trust me and send me patients. But there's not enough GP acupuncturists out there. And I'd be looking very much at the promotion of acupuncturists, responsibly trained ethically trained and being accepted by us mainstream medics as a useful part of patient management. And the sort of things that walk into a GP surgery, Dermot's gone through an awful lot of them. But there is this thing, it's a terrible phrase, but the heart sink patient, you know, you look out in the waiting room and go, oh no. And not because they're nasty people or they're somehow you don't like them. It's because over the years, you've not been able to do anything about them. They're back again. They've been to whatever clinic. The letters come back from the consultant. Dear Dr. Barrett, thank you for referring so-and-so. I've done all the investigations. I find nothing wrong. I've reassured the patient and discharged them to your care. And the patient's sitting there saying, well, I'm still not better, doc. And this is where the acupuncturist has a role, a huge role, because a lot of these sort of conditions, the irritable bowels, the fibromyalgias, the chronic pains of all descriptions, the ones who have an identifiable diagnosis like migraine, who just can't tolerate the medication. The far side of it, when people have been on medication for years at various, and particularly I'm thinking about SSRI type antidepressants, and they want to come off them, but they can't because they get side effects as soon as they start coming off. Stick in a few pins, you can get them off these drugs. And as I say, it's that notion of having an important clinical tool that is largely ignored by my profession is, I think, something that needs to change. So that would probably be my soapbox for today, and hoping that this whole webinar will lead to a more integrated, enhanced awareness of the place of acupuncture in medical practice. So I think that's as much as I would need to say to you. So thank you for your attention, and hopefully enjoy the rest of the webinar. And thank you for organizing it, Tim.
Yeah, thanks very much, John. I think yourself and Dermot have made some really important points. I mean, I've written such letters as you've alluded to. I charge it back to your care, but you know, but looking after these patients is just something they deserve, and this added, you know, acupuncture, I think, should certainly be considered more. And you know, seeing the NICE guidelines and the evidence base is really encouraging, I think. Ger Flaherty had a question there. Ger is a professor of medical education here in NUI Galway, and he had a question as to how is it incorporated into GP training, for instance? I mean, you know, is it in any way structured into GP training? Should it be an elective module in GP training? Or so maybe both of you can take that question. I might start with Dermot, and then John, you might comment also.
Yes, I was trying to get back in the chat function there. So all I can speak for is Cork. So the GP scheme here, getting me to go along to give a talk, a session for a half day to the third year GP registrars in Cork every year. I've been doing that for about 20 years. But of course, all that is just an introduction, similar to what I just talked I gave there about the evidence for and the mechanism of. So I think GPs, generally speaking, have a good understanding of how acupuncture works and what it works for. I think GPs, because we deal with a lot of the problems for which acupuncture is useful for, have a good, generally speaking, a good understanding of acupuncture. About 50% of my patients are referred by their own GP to me for acupuncture. So there is the GP trainees in Cork get some sort of introduction from me. And there's a good knowledge of acupuncture amongst GPs, I think. People like me and John speak at lots of meetings, but there's no formal system. There's no formal system training.
Yeah, and John, you're right. I think you're involved in ICGP. Is there any national talk about actually teaching the practicalities of doing it as opposed to the indications for it, or the?
I suppose the thing is the actual different sorts of acupuncture that are out there. And one of the flaws of the medical acupuncture training is that a lot of people do what I'd call cookbook acupuncture, where they'd just be given for migraine, use liver 3, pericardium 6, gallbladder 20, you know, and that's the same for every headache. It's not quite that easy. This list of set points for set conditions, in other words, using a Western diagnosis, and then saying these are the points for it. It's not going to work because they're not all the same. Like if you're looking at rheumatic diseases, some are cold responsive, some are heat responsive. There's all sorts of different ways of looking at them. So that's kind of why I like the TCN model, because you're taking a full history all over again. You're not just using that set number of points. And that is a flaw with a lot of courses. In the veterinary world, for instance, there's quite a lot of veterinary acupuncturists out there, but a lot of their courses are barely a weekend long. But of course, the dogs can't complain quite so much. And I think, again, that is the problem, that people's exposure to acupuncture is inadequate. And that means that particularly medics will turn around and say, yeah, I did a bit of that and it didn't work. And it, again, reflects a little bit of the chauvinism that you can take what is a 3 to 5 year course in China and condense it into a weekend. It's, you know, it's short sell. I mean, none of us would turn around and say that you could qualify as a GP in a weekend course. A lot of our patients said we probably did, but that's a different story. But it is something that, again, needs to be looked at, is the consistency of exposure and the actual syllabus. And I mean, again, the basic WHO syllabus. I suppose the reason I do TCM type acupuncture versus Diarmuid's one is that's what I learned. It's a model that's been around for a long time. It is a model. I don't have to engage with everything. And like Diarmuid, I would be the world's worst on tongue and pulse and all the rest of it. It just doesn't sit with my clinical mind. But it doesn't mean I can't apply the model. That's all you do.
Yeah. So
yeah, can I just say I agree with John there. Sorry, Tim. That like if to get doctors to actually practice acupuncture, it's not so easy because it takes a bit of time. You can't just do a weekend course and start sticking needles in. I mean, you can, but it's just not, that wouldn't be ideal. So to get doctors trained in acupuncture, again, I was lucky in Canada. We had the ability to do a lot of study, and it was great to go to China for the 6 months. So, but you need that sort of training, practical training. So what I loved about China was that I was sticking needles in patients every day for 4 months. So I think you need that sort of level of experience, that even though doctors will have the background anatomy and physiology and will understand to make a diagnosis, we actually do acupuncture properly, I think it would be selling it a bit short to give a doctor a weekend course and say you can work away now. So I think there's a bit more training involved, you know, whether it would be, you know, 30 days or something, which if it's a part-time course, you need it, you need a good number of sessions, you need it, you know, you need quite a bit of input to do acupuncture properly, I think. And again, it would be unfair, disrespectful to acupuncture just to do very short courses. I think that's certainly true for non-medical people, and even for medical people, where we probably have got an advantage with our training, that you still need a fair amount of time input. I'm not quite sure what the exact amount of time you would need, but I think I was very lucky to get good training both in Canada and in China. And myself and John have spoken about, you know, setting up a course to treat doctors in Ireland. But when we looked at what was required, you know, it takes a lot of input. And certainly people like myself and John wouldn't be able to do it. Now, on a university setting like what you're talking about, Tim, you know, perhaps that's possible, but to train doctors, they'd have to make a commitment to some sort of a comprehensive training.
So I'm Dean of the Faculty of Medicine, Nursing and Health Sciences at the moment. There's 3 schools, so the School of Medicine, School of Nursing and Midwifery, School of Health Sciences, which is occupational therapy, speech and language therapy, social care, and podiatry. But I don't think they get access or exposure to even the indications for this, let alone the practicalities of how you might do it. And then this is one of 6 6 faculties of health or whatever, including Cork, Cork. So maybe we do need to have that conversation about how you build it into at least an awareness of it, and so that it can be considered in the management plan. You know, those problems you mentioned, John, the irritable bowel syndrome, fibromyalgia, chronic pain, you know, they're just such a common part of modern society, and people are suffering from it. And you know, in the hospital we did the test, we ruled out serious disease, so now we discharged them back to care. That's just inadequate. And so hopefully we might develop our systems for that. And after the break, we'll have this panel discussion. I'll be interested in hearing from the other groups about training acupuncture in general, whether it's somebody coming, for instance, we've exposure to podiatry. Podiatry is a new, there's only one in Ireland, one course in podiatry in the country, a BSc, a 4-year course in podiatry. Where should acupuncture fit? Not just on the background of somebody who has a healthcare degree, medicine, nursing, physio, etc., versus straight in from school. So we'll talk about that after the break, as I said, and maybe people, if they have any comments or thoughts, they can let us know. It's 11:17 now. We said we'd break for about 15 minutes until 11:30, so that people can stretch their legs. Or I think there is going to be some video running about Nanjing, and maybe it might be the message. We put a video together for Chinese New Year with Nanjing, and that'll probably run for a few minutes over the break. But we'll come back at 11:30, and we should have time to deal with any issues that people want to raise. So thank you, David. Will you take it from here then?
Hi everyone, I'm Guangming Yang, Chinese Director of Confucius Institute of Chinese and Regenerative Medicine at MUI Galway. Chinese New Year of Ox is approaching. I wish all of you a very happy and healthy New Year, and wish Chinese medicine will be further developed to overcome future global health challenges. 值此新年来临之际，我谨代表爱尔兰高威大学中医与再生医学孔子学院全体员工，祝大家牛年大吉，身体健康，万事顺意。Happy New Year!
As you know, this is the year of the ox, and people born in the year of the ox have been said to have good luck. They're hardworking and they're resilient, and you'll all be happy to hear that I myself was born in the year of the ox, but I won't say how many years ago. I'd like in particular to thank my colleagues here in Galway from Nanjing University of Chinese Medicine, Guangming, Puizhen and Ji. I know it's been a tough year for them. They've been away from home and away from family and friends. But I really appreciate all of their efforts on behalf of the Confucius Institute of Chinese and Regenerative Medicine at NUI Galway.
We are Confucius Institute team at MUI Galway. I wish everyone a happy New Year.
新年快乐！
新年快乐！
新年快乐！新年快乐！
新年快乐 ！Happy New Year!
新年快乐 Happy New Year!
Happy New Year!
I'd also like to thank the broader Nanjing University of Chinese Medicine community, and in particular President Hu and Vice President Sun, who've also been unswerving in their support for the Confucius Institute works. I've had the good fortune to have a number of collaborations with colleagues in China, including Hubbard Medical University and Xinjiang Medical University, and I'd also like to extend my good wishes to colleagues in both of those institutions.
My name is Mike Hubbard. I'm the Mayor of Galway City. I'm delighted to first off wish you all a very happy new year. Jingyan Hao. Very, very different year, of course, with celebrations online and virtually. It's very poignant that this day last year, in fact, I was in China for the first ever time. I was in a city called Chengdu. I met some fantastic people over there. I look forward to visiting China again in the near future. A very exciting project this is with Galway, linking up with the university there in Nanjing in China. And there will be huge opportunities, I'm sure, for both sides to collaborate in the world of medicine and so on. I know Trojan work does go on here in Galway, and the people of Galway, and certainly ourselves as a local authority, will be very, very supportive of the work that's done in the National University here in Galway, a leading university in the world. So again, I wish you the very, very best in that collaboration. I'm sure this is going to be a very exciting project for both sides, indeed. But in the meantime, I look forward to visiting your beautiful city in the near future when this pandemic is over. But until then, I wish you the very, very best. Enjoy the celebrations of the Year of the Ox, and keep safe, keep well, and slán go fóill.
I do look forward in the Year of the Ox to working with colleagues in our global alliance of Confucius Institutes of Chinese Medicine. And we'll work together to promote research, clinical practice, and education of Chinese medicine to a global community.
My name is Professor Becky Way. I'm the Vice President for International here at NUI Galway, and it's my pleasure to wish you a very happy and prosperous Chinese New Year. Although we're celebrating at a distance, it's still important that we take the time to send our good wishes to each other. So I'm delighted to be able to send you this message through video. This year is the Year of the Ox, which is exemplified by honesty and hard work, which I know are characteristics that are of great value within the Chinese culture. And this year of all years, we all need to work hard and to keep going, and we will get through the tough times that we're currently experiencing. So to close, please have a wonderful, happy Chinese New Year, and let's all look forward to a better year to come.
Again, I'd like to wish you all the very best for this coming year. We've all had significant challenges in the year that's passed with the COVID pandemic, but I look forward to better times in the year ahead and meeting up with friends, collaborators and colleagues again face to face in the year ahead.
新年快乐，万事如意，새해 복 많이 받으세요。
祝大家新年快乐！祝你新的一年身体健康，工作顺利和生活美满。
жаңа жыл, жаңа күн, жаңа өмір, келе жатқан жаңа жылдарыңызбен құттықтаймын. Келе жатқан жаңа жыл шаттық пен қуаныш алып келсін. 新年快乐
！Hello， 大家好，祝大家2021年农历新年快乐！疫情期间也请大家多多保重身体。Selamat Tahun Baru Cina！
新年快乐祝你们步步高升财源广进สวัสดีปีใหม่นะคะขอให้ทุกท่านประสบความสำเร็จเจริญก้าวหน้าเงินทองไหลมาเทมาค่ะ
中国委内瑞拉南京终于要大水新年快乐万事如意身体健康 Feliz año a todos Feliz año 2021 venturoso y mucha salud
愿祝各位老师各位同学新年快乐事业有成万事如意祝mừng năm mới
新年快乐 Happy New Year
时光向前的每一刻都是过往经验的积淀
中医药事业向前的每一步都是古往今来的探索
中医药的荣光随着一代代中医人的脚步生生不息
愿南中医海内外校友与全体师生在新的一年里
万事顺遂幸福安康
海内存知己天涯若比邻祝南中医全球合作伙伴及海内外校友新春快乐牛年大吉2021扭转乾坤愿疫情早日结束愿五洲顺遂平安2021加油
春暖杏林花图景
泉流举井水生香
公共外语教学部国际合作与交流处国际教育学院全体师生恭祝大家
新年快乐万事如意
Okay, so it's 11:30, so we might move into the next session, which is essentially a panel discussion with questions and answers. So feel free to input if you have any questions or answers. And I'm really appreciative of the panel members, Shane McMahon, Sang Man, and Dr. Bernadette Ward. Mr. James O'Sullivan, as I said, unfortunately is unwell and will not be able to join us today, so I wish him well. And we might start maybe just make a few general comments in terms of some of the questions that I'd like discussed, and others will have others. But as I said, just before the break, I'm for 8 more months at least, I'm the Dean of the College of Medicine, Nursing and Health Sciences. So we have the 3 areas, as I mentioned, medicine, nursing, midwifery, and health sciences. And one of them had podiatry. As I said, podiatry about 10 years ago was established as a new BSc, first one and only one in Ireland. So we established it here in Galway. So I'm familiar with that journey for podiatry. And I'd be interested in people's thoughts on traditional Chinese medicine and acupuncture, maybe in a similar context. So there are questions like who enters a career in acupuncture or Chinese medicine? Should it be like podiatry, straight from leaving cert onto a CEO course and a 4-year BSc? What about healthcare background people? As Dermot alluded to, there's a very brief exposure in general practice training, but very little else. And in terms of practically delivering acupuncture, what's the structure of training there for an education for a primary qualification, or for somebody who enters it from having already had a qualification? If one is qualified, what are the CME requirements? And much of this, I'm sure my panel are much more expert than me, far more expert than me, and they can comment on that. But CME requirements, who should deliver them? How are they regulated? We might have some conversation around clinical practice in Ireland. Should insurance cover it? Should insurance part cover it? Are there steps one should take to get to that point? Research as a university, all of our teaching is research led. So we do need to address the knowledge gaps and devise research programs. Again, as I said in my introduction, we have the ability in technology terms now to grow brain, heart, kidney from disease patients and from normal siblings of those disease patients. And we have the technology in those systems to correct the defect genetically. So that gives us the opportunity to explore these compounds and products. So a robust research program around this area will be important to consider. So do we need a BSc in acupuncture? Should we have a master's in acupuncture? What's the regulatory elements of acupuncture practice in Ireland or Chinese medicine practice in Ireland? Where do Koru come in? Is it should it continue as it is on the current journey? So as I said, there are lots of more people. As I come from this from the outside, so to speak, but would value people's opinions on some of those issues and any others that people want to bring up. So as I said, we have 3 panelists, Shane McMahon, Sang Man, Dr. Bernadette Ward. Many years of experience in acupuncture between them, both the practice, the education, and so I might start by just asking them to introduce themselves to the attendees, and maybe a brief bio, a few minutes telling us your background. And I know you represent a number of different organizations in acupuncture in Ireland. And again, I'm not familiar with the origins of the organizations, but you could introduce us to that also. So maybe in order of my list, can we start with Shane? Shane, do you want to introduce yourself, please?
Hi there. Yeah, I'm Shane. I've been I started studying acupuncture in about 2006, and I did a 3-year course in Dublin in the Irish College of Traditional Chinese Medicine. And when I finished that, I did a 1-month internship in Zhejiang University of Chinese Medicine. And since then, I've gone on to study Tuina and Chinese herbal medicine. So I've been practicing about 12 years now. And recently, in the last 3 years, I was elected onto the board of the AFPA. And I've just recently become chairperson just before the pandemic, which is a great way to start. So with the AFPA, we're the oldest independent association of acupuncture in Ireland. So we've around about 300 odd members, and we have quite strict standards for who we'll let in. We've got a kind of just to answer, like, this can kind of go into answering your question if you want now about educational standards, that we'd expect all our members to have a minimum of 1,200 direct contact hours, including 400 clinical hours over a minimum of 3 years. That's our base standard. Without that, you can't join our association. I mean,
1,200?
1,200 over 3 years, with 400 have to be clinical. And these would be direct contact hours, so that most courses in Ireland are part-time. So you would kind of expect for every hour of in-person study, you're doing another 2 hours of home study. That's kind of the standard we go for. So you're getting 3,600 hours over the 3 years.
Sorry, did you say 1,200 per year?
400 per year, direct contact. But we'd expect another 2 hours indirect self-study.
Yeah.
Because most people who study acupuncture are working full-time. That's just how it goes. It's private education. So I used to work in a medical diagnostics factory here in Sligo, and I used to spend the weekends and the weeknights studying. So I had no life for 3 years.
Okay. All right. Thanks very much for that. We'll come back into the requirements later, but thank you for that introduction, Shane. And maybe Mr. Songman, will you introduce yourself to the attendees? You need to unmute. You're muted.
No, sorry. What was the question again?
Just introduce yourself.
Oh, yeah, okay. My name is Simon. I've been an acupuncturist for over 20 years. I studied with Dr. John way back in the 1980s. And when I qualified, I went to Nanjing University for 6 months. I did my practical there, and I did my tuner there as well. And when I came back, I opened my practice way back in the 1990s. I also teach for the local college in Shannon, and we have a lot of students. They are ranging from farmers to bankers to physiotherapists to doctors, GPs, and all sorts of people. And we've been doing that for the last, well, I've been lecturing since 2004 in Shannon. So I'm also a board member of the ACI. We are one of the largest associations in Ireland with about 440 members. And like the AFPA, we have set standards for the people to join our association. So we kind of work on similar hours to the AFPA, and about 200 hours in total. They have to do at least 400 hours of practical and the rest of self-study and in-class teaching. So we try to work on the moment with, you see, at the moment, acupuncture is not regulated in Ireland. So basically, anybody could call themselves acupuncturists. And we are trying to get government recognition. So hopefully that will bring acupuncture to a totally new level in Ireland. When I was working in Nanjing, they do Chinese medicine and acupuncture side by side, which is fabulous for the benefit of patients. when I was there, my God, we were doing acupuncture on stroke patients. And everybody in Nanjing literally walked out of the hospital. It's amazing. I mean, it works wonders, acupuncture as a form of treatment, you know. I do a lot in China and acupuncture combined. It's very successful. And I say most of my clients, about 80% of my clients is musculoskeletal, you know, pain management, shoulders, sports injuries. So it's very effective. Combine tuna and acupuncture. And okay, I think I'll.
Okay, no, thanks for that introduction, Simon. We'll come back to you in the questions and answers. But Dr. Bernadette Ward, can you introduce yourself?
Hello, good morning, everybody. I'm Bernadette Ward. I've been involved with acupuncture TCM for a very long time, since the 80s, actually the late 80s. I am an acupuncturist and a herbalist. I did a master's in, it was a clinical master's in Middlesex University, in which it's slightly different in the UK. I did actually get to work in the Wishington Hospital, in the pain clinic and the pre-labor clinics. So it was an excellent master's. Unfortunately, it's no longer available. So I would like to just take a word about further academic progress, as you mentioned earlier. And my doctor's is in education from DCU, but the lovely people in DCU allowed me to do my primary research on the CAM sector, which I've been active over the years in trying to get some sort of joining a team of people and trying to get some sort of recognition for the CAM sector, not just acupuncturists, but herbalists, osteopaths, chiropractors, what they call the big five, their diagnostic therapies, which in many other countries do have recognition, but we don't have, because Ireland has not yet decided, the category, where to put the CAM sector, in which category. So that's why you mentioned Koru earlier. We actually fall between the stools there. So, I mean, since the 80s, we have been going cap in hand to ministers and government and doing presentations and all kinds of things. So perhaps some sort of medical initiative, you may get a better result than we have managed. You also mentioned, degrees. Our college, AFI, we went through a whole accreditation process between 2012 to 2015, and did manage to be approved for a BSc, which we fought for, although it was level 7. But it was suspended because once we had received all the documents and the approvals, it was suspended because the Department of Health still hadn't decided where they were putting, how they were going to categorize the CAM sector. So it's still suspended. So that I think will have to be taken up by people younger and fitter and more energetic than me. But that must continue. Now, it's quite exciting to think that there's a possibility of a master's program being based in Ireland. There are some in the UK, very few, and some of our graduates go on to do them. I've got somebody doing something out of Holland at the moment, and several of our graduates would have done the UK masters. I think there are a couple of different master programs, but unfortunately, I don't know if it's numbers and lack of viability, or but 10 years ago, or sorry, about 7 years ago, there would have been more master programs available. There seems to be less now. So it's quite exciting to think that there might be a possibility of a master's program coming out of Ireland. I certainly hope that it won't be restricted to medics only. I think the I think it was Dr. Dermot who mentioned there ought to be respect for the traditional model, and I absolutely agree. We come from the traditional model, but that doesn't mean we don't work with evidence, and we do, because in today's world, it's no longer possible, you know, to make statements of treatments without backing it up with clinical evidence. So I suppose that's really all I want to say on that.
I think that's helpful and very interesting. I mean, I acknowledge the work you've done over the years and getting to the BSc approval, and then it floundering a little bit because of where does CAM fit. And Chair Flaherty, who's a professor of medical education, who raised a question a while ago, he's been a strong proponent of CAM here in our curriculum, undergraduate medicine at least, but to the point of getting a special selected module in SSM, which a fraction of our students will take and have exposure to that. So maybe thanks for those three bios, introductions, and maybe I'll open up for any questions from any of the participants, or I don't know, Dermot or John, if you want to comment on any of the issues. Like, let's start with, for instance, who becomes an acupuncturist, or how do you become an acupuncturist? So Shane has said the vast majority are in full-time employment, and then they, over a 3-year period, do the part-time requirements to and the self-study and very time-consuming nature of that. Should there be a path straight from leaving cert, as there is for podiatry and other health areas? And I would comment as well that healthcare nowadays is a team-based sport, and you know, you might even question the primacy of medicine within medicine as doctors, but rather, you know, we all function in multidisciplinary teams, and people contribute in different ways to the patient's problems. So should there be a direct entry to a course like you work to create, Bernadette, I assume?
If I may respond to that, yes, there ought to be, absolutely. But we did, you know, in anticipation of this meeting, we, as Wei would have pointed out, we did a categorization of our most recent 100 students, just to see, a small study, you know, by age and gender and even motivation. And I suppose if there's a common theme with graduates or with people who study, and I would have spoken to every single one of them over the years and had conversations, it's highly motivated to work within healthcare, I mean, who studies, yes, they ought to be able to come from their leaving cert and you know, be able to study. Yes, of course. If we look at the training model, the WHO have done quite a lot of work on the training model. It's quite prescriptive for how to train acupuncturists, non-medical acupuncturists and medical acupuncturists. So I mean, that seems to be the agreed standard. You know, within Europe, there are several, I suppose, umbrella bodies. You have the ETCMA and the PFOTS, the Pan-European Federation. So all of these would have associations such as AFPA and ACI, and the UK associations, ATCM, etc., who would be part of these global organizations. And just as you spoke in the beginning about having a global organization for the Confucian Institutes, these organizations, umbrella organizations, have been in place for many, many years. And I mean, what's the purpose of them? To agree standards, to look at research. And yes, we absolutely lack research, and we do need more research. we don't have the capacity, we don't have the funding. A lot of research comes out of the US because they do have the funding and they do have capacity, or Australia, or more recently the UK. But yes, I think that you know, the model is at this stage an agreed standard.
So I'm thinking direct entry is one question, whether there's a demand for it, whether I keep referring back to our podiatry course because it's the only one I've had experience in establishing, which came from, there wasn't one before, you know, that we've,
yes,
and our numbers of applicants are increasing markedly every year. And you know, it's now a very, very established program, about 10 years in. And one of the rationales for establishing was to create a research base as well around foot problems. Foot podiatry was established in 1920 in the US because the foot wasn't looked after. Nobody wanted to kind of look after the foot. The orthopedic surgeons were into knees and hips, and nobody looked after the foot. So there was a demand driven, and now we have a BSc in it here in Ireland. I wonder about, you know, people like who have healthcare degrees, nursing, physiotherapy, whether a taught masters, part-time taught masters would then allow them, you know, practice acupuncture, and whether that.
I don't know. I think you need to get the basics. So I'm not quite sure how you would. You know, just go from nursing or physiotherapy to a taught master's, unless I mean that's just my opinion or my experience.
That's what we're here for. We're here to hear people's opinions. It's really important for us as we try to decide how are we going to incorporate this into our university, if at all. And I mean, we're in the exploratory phase, and so we're very interested in all of your opinions, both from the medical background and non-medical background and healthcare background.
Sorry, I would think that the taught masters, just the model of Chinese medicine is too different to the model of Western medicine. And we do all study a certain amount of Western medicine and anatomy. And obviously, if you have those skills, you wouldn't need to restudy them, but the model is completely different. But it's interesting to note in Portugal, they've just introduced, well, in 2019, they've regulated CAM medicine. And they've got a Bachelor of Science 4-year degree in TCM and a Bachelor of Science 4-year degree in acupuncture. So those courses they don't even have their first graduates yet. I was in Portugal in 2019 as part of an ETCMA General Assembly. We got to go to the college, and it's that advantage. Like, we can't do research because we don't have you know, in a part-time course, we're not given those skills. There's just not time for it. But if you have a full-time course and you've got young people, which is what the profession needs, is more young people getting into it, they'll get those study skills, they'll get those research skills. And I think that's how you move forward. I would imagine the American model would be quite like that, where you'd do a full master's degree in America. It's fully regulated there. And in Australia as well, it's also fully regulated, and you do full degrees. So to me, that would be the way to move forward with it.
Okay. Chair Flaherty has just asked there, do panelists have experience of integrating standalone TCM modules into existing master's programs? So not setting up a new master's program, but taking modules and bringing them into existing master's programs. I don't know if any of you have done any of that.
No, I don't have any experience in that, and in bringing modules in, because I mean, it's such a comprehensive system of learning that it would be very difficult to isolate particular modules and bring it into, and you know, so that it functions within a master's, so a broader healthcare master's or medical master's. Obviously, this is something that some of our doctors could perhaps comment on.
Sure. I just note a message from Sadie Higgins in the question and answers, congratulating you, Bernadette, on all the work you've done over the years, and saying still have very fond memories of your time together in Nanjing, and she would like to see a master's offered in Ireland also. So thank you for that comment, Sadie. And Dr. Burke has said he has to unfortunately leave to go to his weekend rota. So thank you, John, for participating. We have another comment here. I studied acupuncture in UCD with Mary Pender as part of a higher diploma in healthcare acupuncture, and it included lectures and clinical experience, TCM based. So I don't know if whether the panel are familiar with that. It's a study in UCD with Mary Pender as part of a higher diploma in healthcare, and then in brackets, acupuncture. So it seems like there is or was some program under a higher diploma in healthcare.
There was, yes. Mary Pender's a physiotherapist, so it was specifically for physiotherapists. So
okay.
I'm not sure if that's still running.
So that was a path for a physiotherapist.
It was indeed, yes, absolutely.
To become an acupuncturist, because that's one of the educational questions, I suppose, is what are the paths to becoming an acupuncturist, and are they well catered for right now? You know, because we don't need to take on extra work. If there's a value added, then we'll consider it, and but not if it's out there and already well catered for. And we are, as I say, doing this comparison across the 16 countries, the 16, one of which is Portugal. So, and the program you mentioned is in the university that we deal with, I think it's Coimbra. But we've a survey out there amongst them all to say, how do you take people in who haven't had a background before? How do you take people who've had degrees before? Well, how do you educate in your country? And what are the CME requirements once somebody's qualified? How do you practice it? Reimbursement, payment, and how is it regulated? Or is it regulated? And I'm interested, Shane, to hear that Portugal now have regulated the whole CAM area.
Yeah, the whole CAM area. They've got, well, there's eight, and I can't remember osteopathy, herbal medicine, chiropractic. I don't remember all of them, but there was, because I was just interested in acupuncture, Chinese medicine. They've regulated them it was about 10 years ago. They first brought it up in the parliament in Portugal, and it was based on a petition. So they got 40,000 people to say acupuncture, CAM therapies need to be regulated. And then it took a long time from that to actually pass it into law. And then it was 2019 was the first year of school, because we were there, and there was a presentation on it. And then existing acupuncturists, they had to go through, there was a point system based on how much, what your experience was and what your level of education was like, and to see how much retraining you'd have to do. So it was based on your general degree, how much TCM training you had, how much experience you had, how much CPD you had. And if you were under, it was a 16-point thing. If you were under 8, you had to completely retrain. Between 8 and 12 or 8 and 14, you had to do certain modules. And after that, you could, if you were 15 or 16, you could just carry on practicing.
All right, thanks for that. That's very interesting. There's a question from Yvonne Campbell on the chat. Would there be an opening or interest in a master's program for currently practicing acupuncturists that would like to further their education? So would there be, do the panelists think there would be a demand from existing acupuncturists to do a master's for further education?
There is already a demand. I get asked about this quite a lot. Now, with regard to numbers, it wouldn't be a huge number, but I have to refer them to the UK or to some of the European programs that have started. But there isn't in Ireland. I'm sure there would be, and it'd be good to see if there was one based in Ireland.
I'd say there'd be a huge interest in it. Just from speaking to colleagues, I can imagine a lot of people would go for it.
Absolutely.
But you need it to be based on prior learning as well. And
absolutely,
not every acupuncturist has a primary degree, but they could have 20 years experience. And this is, and they could have been training every year. So there'd have to be some way, some bridging system to get them up to speed, to get them into that master's level. But that's what people would like to see anyway.
Yeah, master's is a level 9 degree, and they're generally given to somebody who has a level 8 or.
Yeah, there is a course in the UK done through the Northern College of Acupuncture that will take on students who have no primary degree, and they're awarded through, it was a university in London award the degree or the master's degree, but they'll take into account, you know, experience and prior learning. It's for practicing acupuncturists as opposed to a theoretical one. And that's
as a degree equivalent.
Yeah.
Right. I see Dermot has his hand up. Dr. Dermot O'Connell. Dermot, do you want to comment?
Can you hear me there?
Yeah.
So I would just be thinking from the further education point of view, there are, I'm very interested in what everybody has said there about the various training courses available and degree courses, etc. But I think what has been lacking, and again, I'm going to sing the same tune again, is for an acupuncture training to be combine both the medical understanding and the TCM approach. And I don't, as far as I'm aware now, I could be corrected, but I'm not aware that that's available anywhere in the world, where you've got both the TCM approach and the medical sort of a background running side by side. And if we're going to interest or get buy-in from the medical profession, I think there needs to be something like that. Otherwise, what will happen is that traditionally trained acupuncturists will always be seen, again, being straight about it, as sort of alternative and complementary and quite sort of either in parallel or in opposition to mainstream medicine, or certainly separate from it. So if we were to get, you know, both to train traditional acupuncturists to understand something of the medical model, and to train medically trained people like physiotherapists, etc., to understand something of the traditional model, I think that sort of a training or a course or a master's would be very valuable, both valuable from the point of view of training, but valuable for the medical world and valuable for patients.
Mm. And the masters in that context, Dermot, it would be like a taught masters. We generally it's a 3-semester, you know, 1 full calendar year full time, or 2 years part time generally, which would be the latter being more for people who are actively working, and they might do weekends and such. Could it be run on that type of a model?
Yeah, I would think it could. I would think it could. Like, I mean, I think physios, particularly doctors, nurses, to lesser degree maybe, have a great advantage in that, certainly from the point of view of musculoskeletal stuff, that physios are probably ahead of us all, including doctors, in their basic training there. So adding an acupuncture to a physiotherapist training would be, I think, would be simple enough, and give them a TCM background as well. And nurses, depending, variable, I suppose. Doctors too, similar. So yeah, I think certainly a part-time course could work. As regards to TCM, your direct entry, BSc or whatever in TCM, that would make sense to me with some medical model input. But a master's, I think, would seem to be the more that something which isn't provided, as far as I know, anywhere in the world. Now, maybe Shane could tell me that's available in Portugal or whatever, or maybe Bernadette, but my understanding is that most of the postgraduate courses, most of the degrees are either TCM based or mostly TCM based. I know Fiona Pender's or Mary Pender's degree, our course in Dublin is very well thought of. It's for physios.
Is that still running?
Not sure.
You sure? Yeah.
I don't think so.
Right. Yeah. Then Dermot, in terms of medical doctors and you know, you could say what you want is really that they just have the awareness and refer to practicing acupuncturists elsewhere outside of medicine, if there aren't enough medics themselves who are actually doing it. What approach do you think should be, you know, made to, like, we've nothing in the undergraduate curriculum much, I'm sure, on acupuncture, either its indications or its application and GP training. Do you want more doctors physically doing it as well as understanding it? And how would you train them or educate them? Because they've done their, you know, their medical degree 6 years, and they've done GP training in the middle of GP training. That's probably the best place to put it, I expect, in GP training. But how would you?
Well, you could run part-time course. Would you need a fairly comprehensive part-time course to train doctors in acupuncture techniques? You could.
And how would we get the clinical exposure that would be required? Because I'm sure something like that would require, you're talking about 400 hours a moment ago, Shane mentioned, of actual clinical training. If one was to have a master's, be it combined TCM medical, or how would you build the clinical part into it? Is there clinical practices that would allow students go in and learn, and like we do in regular medicine in our clinical attachments?
Yeah, that's interesting to me. Like when I trained in Canada, we were practicing on each other. And if one had a medical practice like we had, then you just go start practicing on patients, starting out with treating very simple conditions like tennis elbow or something, and then you gradually work up yourself in practice. But if you're training people, you're right, and that's the course that you're talking about, you'd have to have some clinical input. But you could probably use models, model patients as against going into a ward situation.
We're certainly doing a lot more simulation in all healthcare education now.
Yeah.
In fact, we've just started a big renovation of our building here to allow simulation to happen.
Yeah.
Is that what you mean by models, or human?
Yes, I mean simulation or practice on each other, or getting, I suppose volunteers wouldn't be good for needling, yeah. One of the reasons I wanted to go to Beijing was for that very reason, is that I wanted to get a lot of exposure to needling, which I hadn't probably got, in Canada doing the part-time course over a couple of years. So that's a challenge about getting the clinical exposure. I'm not sure how we would fix that.
Yeah, I mean, we'll talk to Nanjing about that, whether some link with them can be set up. But any thoughts on that, Bernadette or Shane or Sang, in terms of education and training, whether it's direct entry or from some other background? How do you get the clinical education, the clinical exposure?
Well, I mean, clinical education is part of the professional training. I mean, we do use role models or sort of models, and also the students pre-COVID obviously would work on each other, would need each other under supervision, and we do have clinics where class clinics where external patients would come in, and obviously we to be treated by the student under supervision. So yes, as Shane would have pointed out earlier, a minimum of 400 hours needs to be undertaken under those circumstances, and that's over the period, and that's what we would undertake. Yes, of course, you're quite right. We don't have the volume of people that you would see in China. This is one of the reasons why we bring our students to Nanjing, because they will get the volume of treatments of patients. And as Sangman would have said, you see the integration within the hospitals, a Western medical hospital with their acupuncture moxibustion clinics, their Tuina clinics, their herbal clinics. So very much an integration. And as you mentioned before, multidisciplinary. Their multidisciplinary would include an acupuncturist, acupuncture doctor, a professor, a herbal, so they would look at various choices for treatment, which are fully integrated. So, to expose our acupuncture students to that model is valuable, and has proved to be very valuable over the years.
Mm.
Sorry, I just wanted to make one point. You mentioned doctors or medics not studying acupuncture. We would have had several medics over the years who would have studied with us and did the whole thing. They would obviously want to specialize perhaps in pain management or one of the areas of speciality. But over the last number of years, we are finding that doctors' surgeries are asking for lists of practitioners that they can refer to. A lot of our graduates would actually work in doctor surgeries, and I'm sure it's the same for ACI or their members as well.
So Dermot, do you see this becoming part of the, the new primary care is all about these centres now with multidisciplinarity? I mean, could there be acupuncturists built into that model?
Yeah, absolutely. I think, like, properly trained TCM acupuncturists would fit in very nicely to our primary care team. Like, again, just to be straight again, like it can be very difficult for medical doctors, for instance. So to get to be communicating with somebody with a TCM training exclusively, for instance, I smile sometimes because I wrote a letter one time, sort of a bit jokingly, to an orthopedic surgeon, saying that a patient had a blockage, had a B syndrome blockage in the flow of chi through the spleen and the gallbladder meridian in their knee, and could he have a look at them, please? So, like, there's nothing that will turn off Western doctors more than phrasing things completely in TCM without some sort of a medical interpretation of what's going on. Now, that the TCM explanation of osteoarthritis of the knee is very interesting, and it does make sense, but there needs to be a sort of a medium. It almost needs to translate the concepts of TCM into medicine, and they do translate quite well, but there's always going to be a little bit, what's the word, suspicion, maybe it's the wrong word, but the TCM concepts don't just translate into Western medicine. And I think trying to find that sort of sweet spot where you have a combination of TCM and Western medicine is what's required. But for TCM trained acupuncturists, to my mind, if they're well trained, and that's why I think if it's a purely TCM training, you need to have people who are well trained in TCM. And an acupuncturist, to my mind, who's well trained in TCM is just as good as me is doing the acupuncture. They'll do it differently, but they're just as good. Maybe better. But anyway, so I just think, though, that if we're going to integrate it, it's going to work a lot better if there's some sort of a common ground and some sort of a training that would present the common ground would be valuable. I'm singing the same thing all the time.
Yeah, there's a question. Sorry, go ahead, Shane. And then
what do you think of the recent introduction to ICD-11 of all the TCM categorizations of disease? That was just introduced.
I wasn't aware of that, to be honest.
Yeah, in ICD-11 with the WHO, they have now introduced all the classical TCM diagnoses into it. It's an appendix, so it's up to each country to opt to use it or not. But they now all have an ICD code, so you could use your B syndrome, and you can get the exact code for it, and you can do that now. I mean, we can't as non-medical practitioners, as acupuncturists, but it could be very useful for research in the future that you can actually code the TCM diagnosis, and you can attach that code to the Western medicine diagnosis. And that was 2019 as well. Everything happened in 2019, and then everything stopped happening in 2020.
Yeah, that is interesting. That is interesting. I wasn't aware.
Okay, a question from Julia Luger. I'm a psychologist, just thus non-medical, and I'm interested in treating mental disorders with TCM/acupuncture. I'm wondering what courses to take to get trained for treating specifically mental health patients with acupuncture. If this fits your panel, I would be thankful if you could discuss this. Anybody with any information on acupuncture approaches to mental health problems?
Yes, mental emotional disorders are treated regularly as part of, and I'm sorry to use this word, holistic treatment, because I know this is one of the words that would probably drive the medics absolutely mad. Yes, it is very much, and actually, I think Ms. Way, when she was speaking about showing her presentation, she spoke about some research that is done in the brain hospital in Nanjing, and there is some really, really good research that has come out of Nanjing in treating mild to moderate depression, even some psychosis. So yes, a lot of work has come out of China with regard to treating mental and emotional disorders. But just on the lower scale, you know, the stresses, the mild depressions, etc., they would ordinarily be treated and taught as part of the regular curriculum.
So she's wondering, as a psychologist, how could she become proficient in the use of acupuncture in that setting? Or
difficult to separate a module.
Yeah, especially in Chinese medicine, to use the dirty holistic word again, I mean, you treat the mind body as one unit. You can't separate them out. So if she's really interested in using TCM, she needs to learn TCM. You can't separate it out like that. Even if you're treating shoulder pain, there could be a mental or you know, people with chronic pain have depression. It's not that outlandish to link these things, and that's part of the basic trainings of Chinese medicine.
I would go so far as to say that, and certainly in my own research for my master's, I would in which I interviewed patients in both the UK and Ireland. One of the reasons they seek acupuncture as a therapy is the holistic aspect of it. They're treated as a person, all aspects of them, rather than you know, their pain, you know, sectioned down to one particular thing. So certainly holism is a valuable concept, according, you know, from the patient's point of view.
Just some comments from Ger Flaherty. He says there's a small number of Masters of Health Science in Integrative Medicine in the US. So there's a master's path into Integrative. And also there are soft acupuncture point practice skills trainers available from the simulation perspective on the market. Okay, so any other comments or questions? So with all your experience now, Bernadette, you know, behind you and trying to develop this area and doing so much on it in Ireland, maybe it's more germane to the next session. What should one, you know, do? What would you like to see happen next?
Well, really, what should happen is that, you know, back to the old bandwagon, but the government should find, you know, a place, an area for CAM therapies, so that it's acknowledged statutory. You mentioned before how it's regulated. It is regulated. The professional bodies, as Shane and Sanban have mentioned earlier, and there's a couple of other professional bodies, do manage their members extremely well. So much so, you also mentioned insurance. We have a professional indemnity. All our members would have professional indemnity insurance, public liability insurance. So much so that I touch wood, I think we've only had one claim against any of our members over a period of time. So much so that you know, the insurance fee is relatively, it's actually smaller than, I mean, I started the very first professional indemnity insurance scheme, and we were paying more back in the 80s than we are now as practitioners, and that reflects the good housekeeping of the members of the professional bodies. You know, they're a strong code of ethics, strong code of practice, benchmarked against the US bodies. So everything we do is benchmarked overseas against the best of the best. So I think that's what I'd like to see happen. Yes, I mean, it would be wonderful to see a master's. The concept of integrating, I don't know a lot about it. I would love to read about it and see how that would be possible. Anything that we can do to reinforce the therapy and make it more mainstream and more acceptable, I mean, has to be a benefit. So I don't know how that would work. I would have to read about that. I must certainly look up those US master courses. It'd be interesting. So that's really all I want to say.
Okay, just a comment from somebody on the chat as well. I've heard of a Canadian pediatric anesthetist talk about how she incorporates acupuncture into her practice as an anaesthetist. That probably goes back to your picture, Dermot, of the cesarean section, and she sends a link McMasterAcupuncture.com. So this pediatric anaesthetist must be McMaster. And that link, I think, is to a contemporary medical acupuncture course in McMaster. I think I need to look at that as well. So there is a medical acupuncture course in McMaster. Yeah, I did. Sangman, did you want to comment as well? You may have your hand up and I may have missed it. I apologize.
We all talk about degree and master degree in acupuncture. It all depends what's been taught at the syllabus. You see, as you know, TCM is not only about acupuncture, it combines herbal medicine, tuna, a bit of kwasa, scraping, and a bit of qigong. So it depends what the syllabus is incorporated a degree or master degree course. So in the West, well, particularly in Ireland, a lot of acupuncture does 3 years course. Well, in our college, the first year we teach medical science that's been taught by Dr. John Berg. And the second year then we teach the theory of TCM. And the third year is all about needling practice, where students come together and needle each other. So as you say, about practice, if you want to be, say, an acupuncturist, if you're already a GP or a physio, you don't have to study the first year because you've already done medical science. You just join second year. You do the theory about yin and yang, the tone, the pose, all the theory about the qi, the blood, the syndromes. The third year is all about needle. We actually needle every point in the meridians, from heart 1 to heart 7, from gallbladder 1 to gallbladder 42, 43. So they do get a lot of practice in that area. So if you mention about a degree or in acupuncture, it all depends what you put on the syllabus. You see, at the moment, a lot of the herbal course in acupuncture is taught differently. In China, if you do TCM, you have to do acupuncture, do the herbal, the tuna. It's all combined, you see. So actually, there's a lot of talk about a higher degree or diploma or a degree in acupuncture. It all depends what's been taught in the syllabus. So I say it is a degree course going. They incorporate everything in the TCM. And for the people that study acupuncture, they could come in, maybe do the herbal, do the tuna, or maybe they do, say, for people in Ireland, they already studied the TCM. So they don't have to do the theory. They just have to do the herbal medicine and acupuncture and the clinical stuff. So it depends what syllabus they put on the degree program. It'd be, you know, how we fit with the rest of the model of TCM. So there's a lot of talk about degree courses. You know, it just, we have to boil down to what the syllabus contains, you know?
Yeah, and that's one question, one basic fundamental question is, are you trying here just to create acupuncturists, or the more broad-based element that you just described with all of the elements? And to me, a simpler approach obviously is acupuncture alone, to have the environment for accredited, recognized, reimbursable, you know, acupuncturists is probably a simpler one than bringing the other. You have a 3-year course, I think you said, Sangman. You have a year of medical science, a year of the yin and yang, and then a year of the actual needling. I mean, it seems like if you were a GP, for instance, who wanted to take acupuncture into their practice, it's the 3rd year of that would be the most relevant. Can you do just the 3rd year?
No, you have to do the theory as well. You have to know about the theory of yin yang, the qi, or the other theories before you can apply the acupuncture to the patient. You know, you have to have an understanding of the theory first.
Dermot, from a medical perspective, when you talk about combining the traditional aspects with the medicalized aspects, the neurochemistry, the neurobiology, would you see a requirement for both years?
I think if you're going on to TCM, I don't think you can just go straight to needling. I think you have to have some basis, ideally a combination of TCM and the medical model for training doctors.
Yeah.
I think it would be possible to train just in the techniques of needling for physios and for doctors, but I think you're missing a lot of the background if you just do that. I think it could be done, but then you're really talking about a short-term, part-time sort of course doing that. And that's probably catered for doctors by the British Medical Acupuncture Society and for physios. I think that sort of short course training in just needling is available. A more comprehensive course involving both the TCM and the medical background to it would be a little bit more involved.
Okay. See, so I'm missing anything on the chat there because I was concentrating on what you were saying. So there's a comment here from Quiva. Thanks, Brenda, for all your hard work over the years in the development of the curriculum for acupuncturists here in Ireland and the work you've done with Nanjing, and to the current board members of AFPA and ACI. It would be great to get regulation in the sector and to have progression with education with a master's course here too. The ETCMA organization in Europe and PFOTS too are great resources and work closely with WHO, etc. So that's a comment from Quiva McGlinchey. Thank you, Quiva. If any of the speakers or panelists want to comment on that.
Thank you, Quiva. Quiva herself has done a lot of work, both on AFPA. She would have been a former chair, Shane, and also very active in ETCMA within Europe. A lot of the practitioners and the people who are attending this seminar are heavily involved and are highly invested in terms of their time and effort. So I think that reflects. Yes, everybody is seeking the same thing. We do have professional regulation, but we would like statutory regulation. And we're not going to fit into CORU. This CORU model, it excludes professional regulated bodies, just statutory regulated bodies. And we're back again to the cycle of not having a place for CAM therapists. And until that happens, and that's, I'm not sure how strong a lobby the CAM therapists are. I mean, we almost had it. There are so many governments that we almost had it. It was like climbing a mountain and then slipping down the other side. A new government and a new set of rules. So it's been quite frustrating over the years. But I think if we persist and the people who come behind us persist, we will get that model. And with that model, you may get your integration of wider, medical, concepts. But yes, I absolutely agree with Dr. Dermot in that, yes, of course, you can section off, the medical teaching in a master's, but you would lose so much of the valuable, concepts. So, but there are ways of having both. You can use a blended learning. You don't need to get into classroom until you start your practicals. So there are ways. There's always a solution.
Ciara McNamara, I think on the chat is also kind of reiterating the point that she'd agree with speakers, the group speakers, that any training has to incorporate the fundamentals of TCM to avoid, as Dr. Burke mentioned earlier, a cookbook level of training. TCM undergraduate curriculum in Portugal is very good. And and Ciara is chairperson of the Acupuncture Council of Ireland. Thanks for that comment. There's another one on the, I have two separate areas that are coming in on the question and answer session. I think it's been an interesting discussion, and thank you all. I think we must go back to Dr. Bernadette's, Dr. John Burke's, and Dr. O'Connell's comments. It's firstly awareness and recognition from the Department of Health. I think this will be paramount for traditional Chinese medicine to advance here in Ireland. So it is 12:30 now, so thanks for all those comments. In the last session, we were going to have essentially is discussions re future plans. So this weekend meeting was kind of timely, as on Monday morning we have our Confucius Institute board meeting with the presidents of Nanjing and Galway, and in that 1 hour we have to describe what our plans are, what our work plan is for the next 2 to 3 years. So we have obviously more solidified thoughts around our research activity and less around the educational activity. We're in more of an exploration phase. We don't want to duplicate. We don't want to start to try reinvent something that's already invented. On the research side, we now have material transfer agreements signed legally between both institutions where we can send materials back and forth. So that was one of our first goals, to consider the laboratories in Nanjing and in Galway as like the end of a corridor. Now, to get over that in terms of customs and tax and shipping and ethics and was not trivial, but now we have that accomplished. Then our next one is to get an intellectual property agreement signed. So what happens if one of their products becomes a major money earner for some commercial company down the line? Where does the value reside? So on the research front, MTAs, IP, getting our stem cell banks prepared and transferred to Hubei, it's another partnership we have, to Nanjing, is going to be occupying a lot of our activities next year. Our global alliance, we've said we're going to draft a report of the status of traditional Chinese medicine in the 16 countries, which, as I say, even in setting up a meeting with them is challenging because it goes all the way from Australia to Arizona. So it's about a 20-hour gap in terms of time. But so to answer, how does somebody go into from like we said, the Leaving Cert type equivalent? How does somebody with a background or fully employed currently train? How do they practice in those countries? Is it regulated? I'm not sure of the 16 how many would say there is a statutory regulation in their country, how many are operating like Ireland with professional regulation. I remember occupational therapy, speech and language, podiatry, they all have professional accreditation and statutory. So these programs here in our college have to undergo dual accreditation visits from both CORU, the statutory regulator, and their professional bodies, the AOTI for occupational therapy and the equivalents for speech and language and podiatry. So it's a dual system of accreditation, quite cumbersome and very time consuming, as one or other is going on almost continuously. So I've given you some basic, very preliminary background to what we're going to do in terms of our research and the global situation. But what I would be more interested in trying to formulate as a result of the discussion is, what should we as a university in NUI Galway, what should we do either to create an educational path from school or from other professions, or focusing on practitioners who either want to be upskilled or CME provided. Because as I said, I don't want to do something. There are three bodies that I've learned about as preparing for this: the ACI and the AFPA and the Acupuncture Foundation of Ireland. So they're three bodies who are doing a lot of work on this already, and we're not here to usurp or but rather add or collaborate, partner in trying to develop this area. So that's my brief introduction. Maybe I'll ask the panelists and Dermot as an earlier speaker for your advice as to, should we just say, actually in this whole space, everything's fine here, we don't need to do anything? Or are there things you would suggest we should at least consider doing? And that can be in partnership with, or well, hopefully in partnership with, or doing it if it's not being done already. So can I ask maybe Shane, I hope not to put you on the spot, Shane, but you know, we've come from a background of being a Chinese medicine and regenerative medicine Confucius Institute. I should say as well that we have all the language things going on that all Confucius Institutes have. So we have general public Chinese courses, we have primary schools activity, we have transition year activities, we have Chinese now being taught in business school and in arts so all that's going on as an expectation of all Confucius Institutes, all 500. And then we've got the Chinese medicine unique aspect. Well, it's not unique, there's 16 of us in the world, but the uniqueness resides in the research focus, because Confucius Institutes generally didn't have a research focus. They were tradition, culture, language, and Chinese medicine. So Shane, any thoughts on?
I think it's great that you're doing this, because it really, I mean, as acupuncturists, we are fighting for status and we're fighting for recognition, and to get someone like NUIG involved in us at all, it looks really well for us, and it gives us, you know, because we, as Bernadette said earlier, I mean, we've been at this 30 years, probably approaching the government and nearly getting it, and nearly getting it, and nearly getting it. And to have somewhere like NUIG looking at the research, it will help us. It will help us in approaching the government to try and get some sort of regulation. I mean, I do think a lot of people would be interested in upskilling, because there are a lot of acupuncturists interested in research, and it's to my knowledge anyway, it's not covered in any of the education here. I just think it's the limit on the time that we have to do it. And I'd love, you know, ultimately I would love if all courses in acupuncture were 4 years Bachelor of Science, that you'd go in and that you'd study and that you'd have a little dissertation at the end, and that you'd maybe then go on to study your master's, because this does happen in other countries. America would probably be the best for that, where they'd all study up to, well, not all, but a lot of them would study up, they call it Oriental medicine, so they'd have they'd be a doctorate of Oriental medicine or Asian and Oriental medicine. That would be the kind of pinnacle of education. And I do think, I mean, we may start as alternative, but we're a profession now, and we're professionals, and we're trying to act professionally, and we're trying to, you know, encourage this medicine, and we need to come out of the corners, come out into the light, and become, you know, regulated and part of the mainstream. Or that's how I see it. Anyway.
No, I think that's a very valid viewpoint, and I appreciate this. As I said, the modern practice of medicine, I think, is a team sport. It's no longer there's a doctor and a few other people who are kind of ancillary in part. I'm a diabetologist, I'm an endocrinologist, so my practice is, you know, I have nurses, dietitians, physiotherapists, psychologists, podiatrists. We're all working together, looking after the patient. And one of the rationales for me in even taking the time to develop this is that I think this is right for patients. This will enhance patient care. So if we have a kind of a centrality in our philosophy, as we did at Mayo Clinic before I came back to Ireland, the needs of the patient must always come first. Then you try to develop things that are going to enhance care for patients. And the diseases that Dermot outlined and John alluded to, and the rest of you have commented on also, are just not met by modern, if you call it modern, state-of-the-art medicine. These people are semi-abandoned, they're angry because they're just not taken seriously. You know, the consultant letter that John alluded to is very germane. I've done the tests, there's nothing wrong with her, I can assure you. I've reassured, you know, so we need to, so I'd like to see greater uptake of this, and we'd like to work towards that. But I think to upskilling, is your comment on upskilling is interesting, your comment on research. All of our masters are 90 ECTS masters, of which 60 is taught and 30 is research project based. So they generally will do didactic stuff from like September to May, and then they'll do a research project from May through August. And that's a 12-month full-time master's. Now you can do it, as I said, part-time as well, but it's still going to be a 60 taught, 30 research component to it. As the taught master, you can do a full-time research master's, which is no didactic component and is full-time research. So thanks for those comments, Jane, in terms of maybe planning for the future. Bernadette, do you want to comment?
Yes, I would agree with quite a lot of Shane says in that upskilling. Yes, there are a lot of acupuncturists who would like to upscale, and if we look at ECTS, I mean the acupuncture curriculum, which I worked on, and I worked on some of the European curricula as well, and it's designed for 180 ECTS credits. So it would, I mean, in a better world in Ireland, in which we would have statutory accreditation of this training, fitting into a 90 ECTS masters would be pretty. The fit would be good. I think it. Yes, there would be a demand for upscaling, and it would be great if NUIG became involved in that, whether that also includes a split model. So you have the medical, because if you choose your subject on masters or you choose your research, if your background is already there and you choose to do a study, perhaps on migraine, or if you're lucky enough to have a good sample for a clinical trial, then it is possible. So yes, upskilling to master's level through NUIG, yes, would be a great boost for the acupuncture profession in Ireland. Yes, I think there would be a demand for it, not just in Ireland, but you'd have a UK cohort as well. Looking for it, because there's a group of people who are always practitioners who are always searching around for further study. This is the nature of it. You've only got to look at me to think it is very much lifelong learning. I mean, it doesn't stop because of age you just keep on. And I love that model of lifelong learning. So yes, there would be a demand for it, and a continuous, and it would broaden. I would think it would be a very viable program.
So a three-year level 7 BSc in the university sector is exactly what you described when you told us you had got that to the point of approval. That is 3 by 60 ECTSs across the 3 years.
3 by 60, and we had to go through the whole sort of thing of learning outcomes and quality assurance and all of that. And despite the fact that everything is suspended, we still maintain our quality reviews on an annual basis. So yes.
And it becomes, in our system, it becomes a level 8 by putting a 4th year, which is research project based.
Absolutely, absolutely.
When all our BScs,
yes,
they're mostly now level 8 because
yes, I suppose there would be. It was 2015 when that far back when we got approval, but at the time we were told it was put at a level 8, but they didn't dare. HETAC at the time didn't dare give us a level 8. Because there is, Dr. Derwood mentioned it, there's a cynicism or a resistance or a disdain for some CAM therapy. So we're fighting against that all the time. And perhaps that is, if we look inwards, it's our lack of ability to produce correct research, correct clinical research, to be able to defend ourselves on the same level playing field. So it's quite easy to dismiss us. So.
Yes. One of the Brazilian director of the Brazilian Confucius Institute for Chinese Medicine, he wanted us to raise that and the stigma associated with Chinese medicine in some jurisdictions, some countries. It varies from country to country, but that also plays into feelings and views from the authorities about these types of things, I suspect. Ger Flaherty just raised an interesting concept that, or was it Ger? No, it was Sarah. But it's a comment about actually having a master's in integrative medicine, incorporating CAMS, mindfulness, nutrition, lifestyle medicine, modern medicine, and would be an interesting course. That's just on the chat, the concept of having a master's in CAMS, not just in acupuncture. So Sangman, maybe I'll just ask you, as I say, we're not trying to do things that other people are doing. We don't want, we want to complement rather than replace or compete with. So what are your thoughts on what the future, what we should do, what things should we try to do to help in this process of expanding access of patients to these therapies?
Yes, it'd be a very good idea, because as Benedict was saying, a lot of acupuncture training in Ireland usually start at a quite late stage. I say if there's an undergraduate program in NUI, it'd be fabulous for the younger generations to uptake this acupuncture model. And as Shane and Benedict mentioned, we are trying to fight for recognition and government statutory recognition as well. So it's wonderful that NUI get involved with acupuncture. It would bring acupuncture pulled up to a new level. And I imagine there'd be a lot of interest in the course to upgrade the skills to improve. As you know, acupuncture is constantly learning. I mean, there's all different areas of acupuncture, acupuncture, and anesthetic acupuncture. It's always something to learn, And I love to do a herbal course myself. At that time, when I was in Nanjing, they mentioned about 5 years course to do a herbal medicine. I just don't have the time, to spend that much time in Nanjing. So yes, I say it will be a big boost to acupuncture when I initiate all those TCM courses in the university,
Dermot, thank you very much, Simon. Dermot, any final thoughts from you in terms of where this should go next?
Yeah, first of all, I'd just like to say what I learned today really was I'm very impressed with, particularly the work that Bernadette has done in trying to get acupuncture training, organized. I wasn't aware of that, and Shane as well with the course in Sandman. I mean, I think we're all in the one boat here. We're all trying to have good acupuncturists, provide good acupuncture to patients. And as you said, Tim, there is a great value in getting acupuncture more widely used, whether it's non-medical or medical. But acupuncture's got a lot to contribute to health, and a lot of the conditions that are common and rampant in the community, acupuncture is an excellent treatment for them. And as regards to stigma and all that, acupuncture can fight its corner because there is a lot of research. Yeah. There is a lot of good research and good clinical evidence in favor of acupuncture. But I mean, I think again, I've been teaching and trying to get acupuncture across to my colleagues, to doctor colleagues for years, both formally and informally. And really the main impediment, and again, to be straight, is that people just don't doctors and medics, generally speaking, there are exceptions, don't buy into the whole TCM concepts because it's just so foreign to them. So I think, again, it's going to play the same tune, but if you're trying to appeal to medics, we've got to show that there is an evidence base and there's a physiological basis to what happens, again, but to give the TCM background, which is important. So I think that would be, to me, the way forward, is to try to get that sort of a combination going. Whether it's undergraduate or postgraduate, I don't know. But I think both would be very valuable.
Yeah, we'd be interested in the research dimension of practice to, even if you took blood samples after various needling, you've mentioned the cytokines that are released and such, but we can measure stem cell populations in the circulation and see whether, they're recruited and activated and thus kind of develop a healing regenerative environment rather than the inflammatory environment. So I think that there's a lot that can be done in this area on both research and education fronts. I'm going to just ask Guangming if Guangming had some technical difficulties joining us earlier. Guangming is the Chinese director of the Confucius Institute in Galway, and maybe if Sanbing is on. Sanbing is in Edinburgh today, so may have issues connecting as well. Do you have any comments, Guangming or Sanbing, as we're about to wrap up?
Guangming, you want to go first?
You're on mute, Guangming.
You go first.
Statement of the year. You're on mute.
Right. I would like to thank everyone and to give the lecture and your experience and for this support. And this is the first meeting we are having. And thank you all for your great contribution. And I also have learned and from your and the experience as well, in particular, and I love to hear and have heard from Dermot and John, and you like to have this and acupuncture for the treatment as early phase as possible, not waiting for the 6 months for the low back pain. Like my father had sciatic nerve. And luckily, that was 23 years ago in Edinburgh. And my friend was an acupuncturist from China, from Zhejiang University. She came to our home only twice a week. But my father was cured in less than 1 month. And the consultant was amazed. What have you done to your daddy, who couldn't come out of bed 4 weeks ago? So I agree, and why do we need to wait for 6 months? And why can't we start acupuncture treatment as soon, as early as possible? And I started for myself in Galway, in the city center, because I was just sitting there and every day for too long. And my left shoulder started to have severe pain and for some time. And this is the third time. And so I'm seeking treatment myself. And thank you so much. And we would love to work together with the platform of the Confucius Institute in your Galway. I'm a biologist. I don't know Chinese medicine. I wish I have learned, but probably it's never too late to learn. I can learn together with the master student together or BSc student together. And while you was talking and bring up, and I was Google and UK, how many and the places, universities they are running courses, and it will be great. And we can organize things together, and it will be great if we act together. We lobby to the government and health and officers and try to have from policy point of view and to make this easier. Thank you.
Thank you, Sanbing. I think our report from the other 15 jurisdictions plus our own will be interesting as well as we present that potentially down the line, what other countries are doing. Gongming?
Hi. Thanks for all the speakers. And it's very splendid discussion here. And as introduced by Ms. Hui, our university, Nanjing University of Chinese Medicine, is the training center of WHO Acupuncture Training Center and has a very experienced, they are very experienced and with very, very talented experts. So we are having the CI, Confucius Institute in Ireland now. So we have very close relation with China and Nanjing. We can collect your requests for acupuncture training, and we can tailor-make some program maybe in China, and also we can find some opportunity to have courses here in Ireland. This is the first webinar, and later we will organize more with Acupuncture Society of Ireland, and welcome all of you to attend the webinar later. Yeah.
Okay, thank you very much, Guangming. It's been a pleasure working with Guangming over the last 2 years. She came here, as I said, in November 2019 with her son, and lockdown happened 3 months later. So it's been a tough 21 months for Guangming and her colleagues, Guizhen and Ji, both of whom are teaching in our university courses, in our secondary schools locally, and in our primary schools, in addition to doing their language teachers. And so thanks to Guangming and her colleagues for sticking with us through this difficult time. So we are going to make this an annual event, so that'll be one thing that we will do into the future. Our quarterly seminar with the Global Alliance of Confucius Institutes of Chinese Medicine, we record all of those, and we've only had 2 so far, but we've got a YouTube channel where they're all recorded as well. So you're welcome, and your members of your organizations are welcome, and we would take ideas from you as to topics which might be we would ask people from the Alliance to deal with and present. On the education front, I'm sure we'll have more conversations coming up. But it's a Saturday and it's spring, and I think it's going to rain in about an hour. So the only dry part of the day you were at this, unfortunately. But we have recorded this, and again, we'll send that to all the registrants, because not all the registrants were actually able to contribute to join us today. And now, because the last year we've been doing all of our education in a mixed environment, synchronous and asynchronous has become second kind of nature to me now. It's very useful to be able to do things asynchronously. So this will be recorded, as I said, and available to anybody who wishes to listen into what. I think the discussion was very important for me, very helpful to me in trying to frame what we should plan to do in the coming 3 years, because we're trying to develop a 3-year work program and define exactly what it is we're going to do with a view to things that are achievable and accomplishable. And if we do make any progress, I'm sure it'll be in the back of huge amount of work done by all of you down through the years. And so we will, I think it's very important that that's acknowledged, and that, so this guy has no background whatever in Chinese medicine, who's he to say anything about anything, but I am here to help and see if we can develop these areas. I really want to thank Dermot and John and Xiaobei Hui from Nanjing University of Chinese Medicine. I want to thank all the panelists, of course. Aileen Connolly is the one who organized this meeting. Aileen is our program manager for the Confucius Institute, along with Louise Burke, who is the administrative assistant. So they'll be happy to help with any questions you might have. David Brandt, thank you as always for the excellent technical support. If we did this without David, we would have had poor acoustics and poor sound, and in particular the link to China he was able to fix before we got started. So thank you, David. He's been an incredible help to us in the last year of doing things by Zoom. We hope next year we might actually meet each other face to face and have a cup of coffee at the break, or wander around NUIG campus for a while afterwards. But thanks to all of you. It's been instructive and informative for us, and we'll see where it takes us in the coming years.
Yeah. One more thing, our Confucius Institute have our social media, and the account name is Confucius Institute, no space, and then space Galway. So welcome you to make attention to it. Yeah, that's all.
Okay, thank you, Gaming. Thank you. So have a great day, great rest of the day, and great rest of the weekend, and we look forward to talking to you in the coming weeks and months. Thanks.
Thank you.
Bye.
Thank you all.
Thank you.
Thank you very much.
Thank you.